Good, good evening, everyone. I'm Dr. Gaurav Pant, and this is the third session of a workshop. This workshop is quite interesting. To start with, we have Dr. Beena Swami, who is an Ayurvedic doctor, as well as a lifestyle wellness person. She is taking session on Ayurvedic cooking. So those guys who are into cooking, those people who have interest in cooking, please prepare your notes for that. Uh, After that, we have Dr. Nisar Sheikh, again an Ayurvedic doctor who will be speaking about yoga therapy. And then we have Maria, who's from Iceland, will be taking class on Che Yoga, followed by Swami Topunidhi of Nad Yoga. And then we have one more session of uh, opening of the back by Deepak Yogi from US. So without wasting our time, I'll request to start the session with basics of Ayurveda cooking. Thank you.
Acupressure. I take many workshops like Ayurvedic soap making, natural care of hair and skin, Ayurveda cooking, healthy salads. I have worked with Art of Living Foundation for a long as Nadi Pariksha. My today's topic is Ayurveda cooking. So let's know about Ayurveda first. Ayur is health, life, and Veda is knowledge. So there is a knowledge of life, how to live happy, healthy and long life in Ayurveda. See, nowadays people see Ayurveda as a last cure or a new method of cure where otherpathy fails. But Ayurveda is our ancient science. Our ancestors used to know Ayurveda and they used to follow it in their routine life. It is said that if you want to promote from a clinic to a big hospital, you can go to any doctor. But if you want to live a healthy life, go to an Ayurvedic doctor. Because Ayurveda promotes nature. Ayurveda brings you close to the nature. Ayurveda's principle is swasthasya swasya rakshanam aturasya vikar prashamanam cha. Swasthya is healthy, swasthya is health, rakshanam is to protect. Atur is a patient or who is suffering. Vikar is any disease or any imbalance. Prashamanam is to cure. So the first part is to protect your health with the natural things. And then second part is medicine. There are many herbal combinations in Ayurveda. So if at all you need some medicines, you can go for herbal preparations. So there is a regime called as Dinacharya and Rutucharya, that is seasonal regime. It is deeply described in Ayurveda. So if you follow this, you don't fall sick at all. So what is Dinacharya? See, from waking up early till night.
Good evening, everyone. Dr. Nasar Sheikh, are you there? Okay, perfect. So next speaker is Dr. Nasar Sheikh. He is an Ayurvedic doctor and he will be taking lesson on yoga therapy. Without wasting much of our time, I request Dr. Nasar Sheikh to introduce himself and start the session. Thank you, sir.
Hi, am I audible?
Yes, sir, you are.
Yeah. So thank you, Gaurav. Only a problem is that I'm just messed up with this technology because right now I've logged in from my mobile phone and I'm just waiting for my laptop to start. So I don't know how it is going to work if I will be able to log in from both. Uh, so let's okay. Yeah. Yeah. Now just leave.
With two system, you need to keep one in mute.
Yeah. Am I audible, Gaurav?
If you are audible.
Because
Yeah, you are.
okay.
But you need to keep
So
one mute. Perfect. Start. Though I can't see you.
yeah, good evening, everyone. I hope. Okay, thank you, Gaurav. First of all, thank you very much for uh, your patience and letting me do this. The topic which has been given to me is yoga therapy. Um, I'm not anyone big speaker who can give lectures because that's not I'm not capable of doing that. But I would certainly share my views on yoga therapy, what yoga therapy for me is. I'm an Ayurvedic doctor. I've just completed my master's in Ayurveda and yoga, and I'm practicing since last 15 years. Whatever I came across in the name of yoga therapy earlier, I had some concerns because first and most important thing is that yoga is supposed to be a science um, which should be used for spiritual upliftment, which should be used for making you a better person, blah blah blah. Then how come a therapy word got connected with yoga? When I go through, when I went through, when I read a few books, especially on Hatha Yoga, I realized that major Hatha Yogic scriptures like Ghiran Samhita, Hatha Yoga Pradipika, Vasishtha Samhita, a lot of therapeutic references were there. That means even if yoga was originally created for your spiritual upliftment, somewhere a part of yoga was utilized for therapeutic purpose also. Now, what is yoga therapy? To understand this question, let us divide yoga therapy word in two parts. First, we need to know what is yoga, and then we need to know what is therapy. So, most of us, if I don't know if you all are from a yogic background, but if you are from yogic background, you will agree that yoga is not merely doing physical exercises, only stretching your legs and making your different poses is surely not yoga. Yoga is totally different than these physical poses. The best definition which suits to my therapeutic approach is samatvam yoga uchyate. because this definition of yoga directly connect me with Ayurvedic definition of health. Why I'm mentioning Ayurveda? Because in the time when yoga and Ayurveda were created, that means in the beginning of creation, Ayurveda was supposed to be the authoritative science of health. When I say authoritative science of health, that in Ayurveda, all the aspects of health were covered. So, whenever you want to talk about health, you must seek its reference somewhere in Ayurveda. For example, if you see Indian scripture writings, so whenever someone write a scripture, its reference is found in its authoritative text. For example, if I'm writing a book and I want to write something related to the grammar, I will be mentioning the things, and then I will have to use a Panini's grammar or whatever grammar books are there. I will have to use them for elaboration purpose. That's the reason why I mention Ayurveda, because many Hatha Yogic terms, specifically about therapy, used Ayurvedic terminologies. So Ayurvedic terminology means for disease, they call it Vyadhi, then there is doshas, there are Dhatu, Mala, Agni. All these terminologies were used somewhere in Hatha Yogic texts. While going through Hatha Yogic texts, I also found some references in Patanjali Yoga Sutra. Patanjali Yoga Sutra, which is supposed to be the most authentic text or most authentic scripture on yoga. So even in Patanjali Yoga Sutra, I came across certain terms which were directly denoting to the therapeutic point of view. Now let us connect both the things. I was mentioning the definition of health in Ayurveda, which says samadha, which says samadosha samagnischa samadhatu malakriya prasannatmendriya manaha swasthite vidiyate. Samadosha. Sama means balanced stage of doshas, that is your bodily humors. Samadhatu, that is the balanced stage of dhatu, that means your body structure. Sama Agni, that means the balanced state of functioning of Agni. Mala, that means your excretion, you're passing your waste products. When all these things are in balanced state, and next to that definition, the next line is prasanna atma mana indriya swasthiti vidhyate. When you have the happy and balanced state of mana, atma, and indriya, when your mind, your atma means your soul, and your senses are in balanced state, in happy state, then and only then Ayurveda call the same person a healthy person. To my surprise, I read the complete Ayurvedic scripture and I found a lot of references to keep dosh, dhatu, mala, and agni in a balanced state. I found whole book was containing with these things only, but very little was mentioned about prasanna, atma, mana, indriya. I didn't found a lot of references where they give any remedy to keep your atma, mana, indriya in a prasanna state, in a happy state. Then again, I remember the rules of scripture writing, that when you want to elaborate some concepts, you have to refer the authoritative science. In one chapter of Charak Samhita, which is foremost scripture in Ayurvedic teachings, one of the chapter in Sharisan, they did speak about this particular thing, that if you want to achieve this state of prasanna, atma, mana, and indriya, you need to go to the yoga. I know it's a little confusing for you. I'll make it simpler. That a healthy individual can only be called the person who has got balanced state of all the bodily humors and the happier state of mana, atma, and indriya. This is one part. The second part, Yoga tells in it, yoga explains its definition in Bhagavad Gita as samatvam yoga uchyate. That means equanimity. Again, the balanced state of a human being is yoga. So when you want to achieve balance from Ayurvedic perspective, you certainly have a clear reference for the same from yogic perspective. And to keep the happier state of your Atma, Mana and Indriya, you have no choice other than going for yogic scripture. That means somewhere in ancient time also, even before the time of Hatha Yoga, certainly yoga was looked upon as a science to be used in therapy. Well, I think there are some messages, but I'm not good with this thing, so sorry. Gaurav, please tell me if something is someone is asking something, because I can't see
No,
anything
please
over here.
continue. Please continue with it. Please continue with your talk. We'll take care of it. Thank you.
Okay, sure. So now, in current world, when we look at the whole world, the scenario, you find a lot of terms, lot of things going on in the name of yoga therapy, especially yoga therapy for heart, yoga therapy for joints, yoga therapy for diabetes, yoga therapy for asthma, and all these things. I personally don't agree with that. Yoga therapy can only for a human being, because nowhere in yogic scripture I was able to find a word which is even related with diabetes, which is even related with asthma, any joint pain, nothing. That means yoga therapy necessarily should be something different than what you and me are thinking right now. What we are doing is an extension of physiotherapy. It's an extension of neurology. It's an extension of some other science. So let us today try to understand what exactly real yoga therapy, which is expected to the yogic scriptures. We'll go stepwise. The first thing that the first reference of yoga therapy, which I would like to put forth, is from the Patanjali Yoga Sutra. Patanjali Yoga Sutra, which is divided into the 4 chapters, if you know all those things like Samadhipad and Sadhanpad and all this stuff. In first chapter, Patanjali gives all the tools, all the things, what you want to achieve. And while explaining that, he mentions the Antaraya, then he mentioned the Vikshepsa. In this Antaraya, Vyadhi, Styan, Sanshay, all these Antarayas are nothing but the diseases which might affect a person, and the solution of those diseases can only be found through yoga therapy. If we consider today's scenario, let us take example of COVID. We cannot forget COVID, otherwise I would have been standing in front of you. Because of COVID, we have to choose this. So even in case of COVID, the physical part is smaller and the psychological part is got bigger. Recently, I read an article in one of website that the maximum deaths those occurred, those were because of the fear factor the patients were having. And Patanjali exactly targets at this fear factor, that when you get this kind of fear, when you get some kind of doubts, your disease increases a lot. So when you take out that fear, when you take out that doubt, certainly patient is going to go towards cure. That means even in Patanjali Yoga Sutra, you get the references of therapeutics. In Hatha Pradipika, one verse, I think that verse is in first chapter. Swatmaram is talking about Matsyendrasan, and in Matsyendrasan he says that by the practice of Matsyendrasan, you can increase your gastric fire to a level that you can even digest the toxin, you can even digest the poison. And in that particular verse, he is using the word kadashan. Kadashan is the word which is used for the junk food in today's time. So the food which is stored, the frozen food, the food which is genetically modified, what we call it as a GMPs nowadays, the food which is mixed with lot of other things. For example, salt is mixed with curd, the honey is heated up, half baked things are there like pizza and all these things. So all these things what we are eating in our daily regimen or our as a daily routine, this condition plays a very important role. And Swatmaram clearly mentioned that even if someone who is eating kadashan, who is eating junk food on regular basis or a lot of junk food, the practice of Matsyendrasan can cure that junk food eating habit also. I mean, the effects of that junk food eating also. That means somewhere Swatmaram had this thing in his mind that this asan can particularly be used in the disorders which are caused because of eating this kind of junk foods. If you come to the again current scenario, 10, 9 out of 10 diseases, I'm sure, are because of our eating habits, our lifestyle. That means yoga or the gurus or the those who wrote the scriptures thought of yoga therapy long back, which we really need to bring out. When we just speak about yoga therapy for diabetes and yoga therapy for these modern diseases, we limit this therapeutic approach. We limit this effect of yoga to those particular diseases. I think that if we go and if we try to search, if we try to find what real yoga therapy wanted us to do, we can explore many bigger things also. Another example I would like to give for explaining therapy, that any kind of therapy has got certain characteristic. For example, in case of Ayurveda, when patients walk into towards me for the treatment, the first thing what I do is to examine that person from my perspective. So even if he is complaining that, okay, doctor, my reports are so and so, my thyroid has gone to the toss, I got hypo or hyperthyroidism, I don't give much importance to those reports because my science tells me or explain to examine the patient and make my own diagnosis. So when for a yoga therapy, the real yoga therapy, a person should be examined in yogic way. That means if you really want to practice yoga therapy or you want to go for yoga therapy, you need to develop your own technique of diagnosis. You will have to develop a technique which will give the investigations. So you should be capable of enough. You should be capable enough of doing yogic investigations, yogic diagnosis. You need to find out the causes, yogic causes, or causes in yogic way. What has caused this particular disease? Again, I'll give you an example of the same this thing, the thyroidism. So a lady, I mean, in almost all thyroid cases, you can relate all these things. A lady who had come to me for a thyroid treatment, she was on thyroid medications for more than 15 years. And no matter what kind of, whatever medicine she was taking, she was not getting benefits. All the symptoms were there. Most of the thyroid symptoms are your heart beats faster, your voice become hoarse, there's a lot of anxiety, a lot of sweating. So these are all the symptoms of thyroidism. When I checked her from yogic perspective, I did spoke to her about causes and all these things. I found one very classic and very common cause in all these thyroid patients, specifically in that lady, that she had a lot of stress which she was not able to express. She had this problem for childhood that she said that, okay, I cannot express myself. So even if I have some emotion which is bursting in my side, I can't let it go. Then I started thinking on yogic point of view, that what happens, what terminology does yoga science gives us when you can't express yourself, what exactly get affected from yogic point of view. And I was able to find out that Udana inability to express themselves. Now the seat of Udana Pran is from here to here. This is the seat of Udana Pran. So when Udana Prana get disturbed, it will disturb all the functions. Hello?
Hello. Yes, Mr.
Thank you. Well, I am connecting from my mobile now. I think there's some problem. Otherwise, is that okay?
Yeah, we'll be taking Q&A in last 5 minutes.
Sorry?
We will be taking, there are a few questions we will be taking in last 5 minutes of the session.
Okay. That sounds good.
Thank you. Please continue.
Yeah. So when I was dealing with that Udan particular case, then I was able to give that lady a specific practices. Those are designed for, say, to improve your Udan pran. And by doing that, I got a very good result. I will again say that I did connected much on reports point of view, but she started feeling better because the practice is very pinpointed. That means yoga therapy needs to be practiced from yogic perspective. If I was treating her only for the thyroid thing, which is the set formula for thyroid, okay, do the Matsyasan and do Ujjayi pranayam, only that could have limited me to get results only for the thyroid thing. But now I was able to give her better relief on different levels. She was feeling better on physical level as well as on mental level. So not only her problem for what she had come to me, but along with that, many other problems also got better. And this is what is the magic of yoga therapy. But somehow, because of our impressions of modern science, we try to connect everything with modern things. Because when someone is talking about that, okay, we want to know the scientific benefits of pranayama, we immediately start thinking that, okay, carbon dioxide and oxygen and nitrogen and blah blah blah. If someone is asking that how meditation helps you, you need to prove that things on how my brain waves are working and how EEG changes are there and how different investigations are there. Why? Yoga therapy is much richer than what you and me can think. Yoga therapy basically works on 5 levels of existence, what is popularly known as Panchakoshas. Panchakoshas are Annamay Kosh, Pranamay Kosh, Manomay Kosh, Vigyanmay Kosh, and Anandmay Kosh. If we correlate these koshas on our level thing, then Annamay Kosh is your physical level of your existence. Pranamay Kosh is your physiological level of existence. Manomay Kosh is psychological level of existence. Vigyanmay Kosh is your intellectual level of existence. And Anandamay Kosh is your spiritual level of existence. There is no sixth level than this. All your problems, all your functions, you as a human can only be distributed in these 5 levels of existence. So if you have some problem on physical level, certainly the asanas are going to help you. If you have body stiffness, if you have some joint problem, then certainly on physical level, asana does help. But if you start thinking for yoga therapy from yogic perspective, you will not only work on physical level, but on different levels, like physiological level. All the problems which are related with your physiology are counted in physiological level, and there could be a different set of asanas, there could be a different set of other practices. When we talk of yoga therapy, or when we prescribe a patient a yogic remedy, what generally we do? Like, even if you decided to take treatment for yourself from yoga therapy, what will you generally expect a person to give? You will expect that, okay, I need to do this particular asana, I need to do this particular pranayama. That's it. Very rarely, some of you or some of the yoga teachers they might give you some cleansing processes. Now, to decide on cleansing processes, again, it is difficult. So most of the times, cleansing processes are taught only on institutional levels. But yoga therapy, the treatment of yoga therapy is not only this, but the treatment of yoga therapy also extend from yamas and niyamas. So when a patient is coming to you, or when you are treating a patient, maybe in yoga class or wherever, you also need to consider this person got this particular disease because this part of yamas is not perfect in this, or he's not following this particular. For example, Satya. You need to diagnose a person that because of his habit of speaking asatya again and again and again over the period of time, he has developed this disorder. That's the real yoga therapy. Maybe you can diagnose a person that, okay, from a niyamas, the santosh part is missing. This person has, no matter what he achieves, he's not satisfied. So you should, in the long run, be able to pinpoint a cause as santosh, and then you should treat that person for that santosh part only from niyamas. Coming back to asanas, which asana should be done by whom? How we decide that? Only because some of a great teacher has written that for the back pain, the backward bending asanas are good. For heart, topsy-turvy asanas are not recommended. Only because someone has written, you just follow that. What is your point? How you decide which asana should be given to a person? Patanjali himself gives it in his definition. If you read the Patanjali's definition of asanas, it clearly says the process prayatna shaitilyam ananta samapattityam. And if you do asanas in this way, what you are going to get? Tato dvandvana abhighata. Stiram sukham asanam. We know all these things, but we never learn next two definitions or next two verses of that particular asana. That okay, asana is to be done stiram and sukham, sthirata purvak and sukha purvak. But how? Then prayatna shaitilya should be there and ananta samapatti should be there. When you have all these things, sthirata, sukha purvakta, prayatna shaitilya and ananta samapatti, then what you are going to achieve is tato dvandvana abhighata. That means asanas can be used to get rid of dvandva. And what is dvandva? Dvandva is conflict. Dvandva is duality. Dvandva is confusion. Dvandva is frustration. All the psychosomatic diseases can be treated with asanas if asanas are chosen, selected with this particular way. That's sthirata purvak, sukha purvak. Then the next, I'm sorry for the disturbance. Sthirata purvak, sukha purvak, prayatna shaitilya purvak, and you have to find the ananta samapatti. When you go deeper into that, you will be able to find a particular asana for that particular person. It's not like that. Back bending is only for the back problems. I have treated several back pains by giving Janu Shirasana. I have treated several back issues by giving Paschim Tanasana, which were exactly contraindicated. But my diagnosis for their back problem was different. How to diagnose such things? That is real yoga therapy, and we really need to learn that what kind of asana should be given to what person. Same with pranayama. Pratyahar can be a very good part of yoga therapy. Yoga therapy can never be completed without using pratyahar. So when you give yogic prescription or when you do yoga as a therapy, remember all these aspects should be counted. All these aspects should be utilized. Now, how to diagnose things? To diagnose things, you need to know what is yogic anatomy and what is yogic physiology. Because any kind of therapeutic science, it required certain basic components. So unless and until you don't know anatomy, how human is formed, what we mostly know about anatomy, that there is different. Okay, if we go deeper, we know that cell comes together to form atoms, come together form cell, cells come together form tissue, tissues come together and they form some organ comes together and form a system, and different system forms a human being. That's what anatomy we know. But yogic anatomy goes far deeper and far greater than this understanding. So yogic anatomy gives you, if you read this Sankhya chart, Sankhya's chart of evolution, then you will understand how yogic anatomy takes you deeper in. So if you have problem somewhere on psychological level, yogic anatomy will pinpoint from where that problem has started. If you have problem on intellectual level, you're not able to make the decisions. You're always being confused about you have confused about your decisions. You have doubts about yourself. Then the knowledge of yogic anatomy will give you a pinpoint answer that, okay, there is a problem on this particular level, that, okay, the ahankar, the problem is in ahankara level. If you diagnose that, okay, this particular ahankar is disrupted, and because of that, he is not able to take decision. He is not able to take decision. Because of that, he is continuously into stressful condition. And because of that stressful condition, his sugar level is increased. Then no matter whatever pranayama you give, that is not going to help his stress level to come down. No amount of asanas can help him to bring down his sugar level unless and until you don't diagnose him on that particular level and select the practices. So yoga therapy has very wide way of understanding. You can use yoga therapy in much bigger ways than what we are thinking right now. Same with yogic physiology. Physiology means how your body functions. So right now we know that when air goes inside, air comes outside. That's how the lung work. The heart is four-chambered heart which pumps and it throws the blood into the vessels. The blood goes all over body, collects the carbon dioxide, and these things distribute oxygen, comes back throughout the. All these things we know. But if you go to yogic physiology, you will get even the deeper understanding of that. Yogic physiology, you can use panchakoshas for yogic physiology. You can use shad chakras for yogic physiology. You can use nadis. These are also part of yogic physiology. That nadi shodhan pranayam. What is nadi shodhan pranayam? Who should do that pranayam? Why should one do that pranayam? Because nadis will be clean. If nadis will be clean, then all these channels will be clear. The energy can flow better. If energy starts flowing better, certainly chakras can also will start functioning better. If chakra starts functioning better, the flow of energy will improve. Flow of energy improve, certainly you're going to get better energy for your thinking process, for your conscious. So my point is that unfortunately we have diluted or we have downgraded yoga therapy just to make it understand from modern perspective. I have no objections using yoga therapy from modern perspective. It's is claiming that with the help of yoga therapy, he got rid of cancer. I'm proud of that. If somebody says that, okay, I'm practicing yoga therapy for last 10 years and my blood pressure is under control, I'm proud of that. It's really good. But my question is how? And Indian sciences, our Vedas are so rich. Our Upanishads are full of knowledge. And Patanjali, Swatmaram, Gorakshanath, they have done tremendous work by compiling all this knowledge from yogas and Upanishads and given us many directions to use that. And what we are doing, we are just treating the reports based on some laboratory investigations. This is not yoga therapy. This can be called as a use of yoga in that particular disease, but not yoga therapy. Yoga therapy is much bigger and much better. Last year I was in US and also in European countries. I did speak about the autoimmune conditions. The autoimmune conditions are at such a rise that in America, my host, she was telling me that some 3 out of 10 are supposed to have some kind of autoimmune condition. And in autoimmune condition, steroids right now remains only an option. So you have to keep taking steroids all your life. In India, in my clinic, I witnessed almost 100 plus autoimmune conditions. What is this autoimmune condition? What are these new diseases? From where these diseases which doesn't have any answer does come? Patient come to us that, okay, doctor has asked us to take diabetes medicine and we have to take it till the last breath. Doctor has asked us that, okay, we cannot stop steroids. Doctor has asked us that, okay, blood pressure medicine needs to be taken all my life. Thyroid medicine, okay, I need to take it all my life. Then why is this happening? Because we are not working on all the options that we have. And the biggest option in every incurable disease, I feel, is yoga therapy, because yoga has got answer on physical level. Yoga has got answer on psychological level, and yoga has got answer on spiritual level. Now, somewhere the modern science has started agreeing that, okay, the disease can be transferred from my family. So my grandfather could transmit the disease to me. Up till now, they were saying that there are certain diseases which are inherited. But now they are coming to an agreement that, yes, even frequent habit of cold, frequent habit of sneezing can also be inherited. Either of parents had severe acidity and the child has developed that particular kind of disease which arises from that acidity. The same thing is autoimmune condition. You have been cheating your immunity for your last 3 generations. So 4th generation is going to born with more chances of getting autoimmune condition. And yoga has got answer for this also. Yoga can literally tell you that where this started and how you can stop it. But for that, we really need to take yoga therapy seriously. We need to think of yoga therapy from different dimensions, from different viewpoint. If we keep on just going behind this asana for back pain, this asana for abdominal diseases, and this asana for your hair fall, then we are going to get only this limited. We always will be the secondary, but yoga therapy certainly has got much bigger scope. Almost every disease that is present on earth can be treated with yoga therapy, at least can be helped with yoga therapy. And this is what I'm telling you. Sorry. This is, I'm telling you this from my personal experience that I'm seeing in my patients, that if you can pinpoint the cause of that particular disease on different levels. Just like I gave you example that sugar is increased because of the stress on Vigyan Kosh. So treating his blood sugar on physical or physiological level will be of no use, neither with medicine nor with yogic practices. You will have to select the practices to be which will work on Vigyan Kosh. Then and only then the person is going to get all right. If you are giving just in a shavasana to treat your psychological disorder, then I don't think that the patient is going to get benefit. I see many people, those who are under stress, even yoga therapists, they just suggest, okay, you do meditation, but you know, the meditation is strictly contraindicated in certain psychological diseases, especially the stress and anxiety. The meditation can increase the problem. In my own practice, I had given this prescription that, okay, stop doing all yoga practices and this is your yoga therapy. Why? Because for that particular person, my diagnosis from yogic perspective was that too much of the suppression is not good. And which he was doing all those yoga practices which were suppressing him. So friends, coming back to the point of yoga therapy, I would like to give you a very clear understanding that just go back to the roots, go back to the scriptures, the original scripture, instead of learning the commentary, instead of learning the textbooks, go back to the scripture and find out what kind of therapeutic references you are getting, and this will be the real yoga therapy. I think we have 15 minutes, and Gaurav had said that we are giving 15 minutes for question answers. Gaurav, are you there? Well, there is a question how we can go beyond modern yoga therapy concepts. Are there some tools apart from self-analysis and observation? Manoj, yes. Of course, there are tools apart from self-analysis and observation. But what's the problem with self-analysis and observations? Scriptures had given us so many of ways. I mean, forget about bigger books, but even if you consider Ashtanga Yoga in its true sense, even if you start studying Ashtanga Yoga, and if you start studying it from its root, you will come to know that we can go far beyond modern yoga therapy with the help of that Ashtanga Yoga. How we can diagnose polycystic kidney under yoga therapy and plan yogic therapy and other asana, then asana and pranayama. This is what my point is, Yogesh, Manoj. Why you want to diagnose polycystic kidneys? You know, many of the kidney diseases are not even the kidney diseases. I know if you are too much influenced with modern science, you will find my claim little surprising. But according to Ayurveda, the production of urine that takes place actually in intestine. Grahani is the organ where this takes place. And if you find all these kidney disorders, you will find one common thing, that all of these people have some problem with their guts. Unless and until you don't treat their guts, you don't treat their grahani, the complete digestive organ, you don't get a good result in kidney things. Ultimately, you have to go for dialysis or other problems. That's the reason why so many dialysis units we need now. One is our food, lifestyle, and second, our approach. Our approach is we are just looking at kidney, but kidney dysfunction can be because of dysfunction of intestine. So first, you need to clear the input to the kidneys. If kidneys are continuously getting excessive toxins than their capacity, then certainly the kidney function can happen. And about polycystic, that's why you want to diagnose. You first see the symptoms. You diagnose on your own. Yoga nowhere mentions polycystic kidneys. But yes, yoga has given practices for proper malamutra visarjan. They have given cleansing process for the same. So you can help the person of polycystic kidney much better with this. Which scriptures book to refer for therapy? Alpa. Every scripture. Right from Vedas, Upanishads, Brahman, Aranya, Yog Sutra, Hatha Yog Pradipika, Hiran Samhita, Vasishta Samhita, Shiva Samhita, every book, and you will find the reference for therapy. You just need to be sure that our science is a true science. So as I said, in Patanjali Yoga Sutra, right from after Atha Yoganushasana, right till the last sutra, every sutra can be used for therapeutic purpose. Yoga's Chitta Vritti Nirodha can also be used in therapy. That's the basic principle of yogic therapy. This is the ultimate goal of yoga therapy. This is the diagnosis, that you should be in a position to diagnose that particular vritti of this particular person is itaratra. Where it is, you should be able to diagnose this. So you refer any scripture and you will find the therapeutic reference. You just need to be aware. You just need to be little more. You should think positively for you. Unfortunately,
There's one more question, sir. With by Tejasvi Kamble ma'am. How work with elderly? How I work with it? How yoga can help in precautions? She is an occupational therapist. She works with elderly people.
I didn't understand.
You can see the question.
You want to ask?
Can you see the question?
No, there is no such question in question and answer.
Okay, so there is a Dr. Tejasvi who is an occupational therapist. She worked with the elderly people. She is
Okay.
asking how yoga can help with precautions to the elderly people, I believe.
Well, let me answer it not only from yoga, but Vedic yoga therapy, what I call it, which is a combination of Ayurveda and yoga. So Ayurveda says, as in a prayojan of any therapeutic science, that swasthya swasthya rakshanam aturasya vyadhi parimuksha. Swasthya swasthya rakshanam necessarily is prevention. Every human being right now, be it elderly or be it a younger generation, they can prevent all the diseases which might occur with the help of yoga. You just need to find out for those particular person what yoga need to be done. Most of the elderly people lack the first two, yamas and niyamas, because they have lived their life either in greed, either in some kind of they have their regrets, they have some kind of failures which are continuously pressing them. So you need to find out what are the problems with those people and just give the practices accordingly. Elderly people can be the most um, uh, what we call it. They are the biggest target of yoga therapy. You don't need to give them asanas. You just need to give them the real understanding for life with the help of pranayama and pratyahara and all this stuff. That way you can help with the elderly. If particular problem, then yes, we can certainly talk about it.
There's one more question. Could you help with the food that completely avoid for PCOD?
Something that is general, sir. Yes, I mean, in my clinic, I ask, I mean, that will be a little strange, and this may not be a right platform, because to understand this, we really need to think from different perspective. Most of the elderly people, I give them Kriya Yoga. Kriya Yoga, Tapasvadha, Ishwar Pranidhan. You need to understand what is tapas for that, what is swadhyaya for that particular person, and what is Ishwar Pranidhan for that particular person. Tapas is not fasting. Swadhyaya is not reading scriptures. And Ishwar Pranidhan is not surrendering to God. No. Tapas is particular efforts to be taken by that particular person. Swadhyaya is understanding that what went wrong, understanding in the right way. And Ishwar, Pranidhan, continuous dhyan of Ishwar. That means you have to become an ideal person. What need to be done for that is Ishwar Pranidhan. So for every elderly person, you can suggest some kind of Kriya Yoga.
Thank you. There's one more question.
Certainly.
Could you help with the food to be completely avoided for PCOD and specific yoga asana?
Yeah. PCOD is a disease or a condition. It is not basically a disease. It's a condition which is majorly caused because of the lifestyle. Vata and Kapha are supposed to be the major component which generally gives the rise to PCOD. So first of all, increase the ghee intake, your motion habits. So passing of your urine and passing of your stool should absolutely be smooth. Clearing your digestive system is the most important treatment for PCOD. As far as food are concerned, strictly avoid any packed food. Paryushitanna, that means stale food. Any food which has been kept overnight is stale. So if you want to eat chocolates, make fresh chocolates and eat them. Don't go for those packet chocolates. Chips, okay, if you want to eat chips, there's no problem. Fry the chips at your home in good quality oil. Don't use a little spice which will not be addictive, like this salt. I don't remember the name. What is called the salt which is addictive. Don't use those masalas. You can eat cheese. If you want to eat pizza, think if you are able to digest the pizza or not. If your hunger is enough, if your fire is enough to digest the pizza, then even in PCOD you can eat pizza. Otherwise, no. Basically, sabzi roti dal chawal. If you are an Indian, sabzi roti dal chawal is the food to be taken at least for 3 months regularly without any break, and PCOD symptoms will start reducing.
Thank you, Dr. Desar, for a wonderful session.
Thank you,
Before
Gabriel.
we end this session, we have done a mistake, not with you, Dr. Nasar, with Dr. Veena Swami. Uh, Actually, there was some electricity outrage at Iceland and some European part of the country where we had our speaker. The speaker cannot come on board, and with the hesitant to work on this event to maintain the event flow, we have put Dr. Veena Swami up on the schedule. I sincerely apologize to everyone that we have break the schedule, but I again it was need of our to you know to continue the flow of the event. Uh, we will be giving a written apology to Dr. Beena Swami what we have because we have changed the schedule without informing her, and we will be providing everyone who wants to have her uh, videos through email by the end of this evening. Uh, that is all from our end with Nisar. Yes, so Tejasvi ma'am, please, I really apologize. I believe you were looking forward for her session, and uh, we supposed to put her session up, and it was a need of an hour, and I really apologize for that. If there is any other question, please let us know. Perfect.
Okay,
So
so
thank you, Dr.
thank,
Nassar. We will be
thank
sharing
you.
your number and contact. There is ma'am, Dr. Ms. Tejasvi ma'am, who wants to connect with you. She has already given a number. Uh, can you see it? What I'll do, I'll text you this number.
Please, 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 please. Thank you.
Thank
Thank you,
you.
and thank you for the opportunity, Gaurav. See you soon. Bye.
Thank you, Dr. Nassar. Well, that was Dr. Nassar, and again, uh, I have to apologize for something which cannot be corrected. The next row of the session, we are trying to reach Maria. She will be joining us of sending videos, whatever possible in next 5 minutes. We will have 5 minutes break, and then we'll continue the session. Thank you. Next on the row, we have Maria Onslow from Iceland. She is a yoga teacher from last 40 years, and she is taking session of chair yoga. She has been a pioneer in the Iceland for spreading traditional yoga and hatha yoga. Now she is teaching old people about chair yoga and its benefit, and also spreading the awareness of yoga in Iceland. Please bear with us and as she joins in on the video. Thank you.
Namaste. My name is Mari Olsen and I live in Iceland. And I want to start to thank the persons, Dr. Gurav and all the others, with you guys today. So I won't say many things. I will just give a couple of words about what we will be doing. I hope you're all okay. So first of all, many greetings. Namaste from Athens in Greece. I hope you are all doing fine. So we will be doing yoga asana sequence from Krishnamacharya's Vinyasakrama system, which is the first sequence, and we will be doing some movements from the first sequence because it's quite long. That are movements that are activating all the joints, starting from the fingers, the wrists, the head, the neck, the shoulders, going down towards the hips, the knees, the ankles, and the feet. So these movements will be releasing stuck energies from the different joints in the body, as well as opening and stretching out the muscles that are supporting the joints. So we will keep it very simple. The sequence we will be doing standing up. So you should have a comfortable space because we will be stretching arms out to the side and so on, so that you can move around freely. The other thing that is very important for this sequence that we'll be doing is to focus on the breath. So in fact, the breath is actually more important than the movement. So each time when we say inhale, raise your arms up, really just finish your movement when you finish the breath. Don't finish the movement or don't finish the breath and before the movement ends. So try to make the most out of the movement at the same time making the most out of the breath. Okay, so I will be giving you the guidance. Inhale, we will do that. Exhale, we will be doing that. So I will just start, and I hope you can hear me all very clearly. And I hope you enjoy the sequence and get a nice activation and blood circulation in the body. Okay, I will start. All right. So just move that you can only see. Okay. Okay, so I'm a little bit further away, so I will speak just a little bit louder. So we're going to start with the first position. Our feet are parallel, connecting very well your big toes, your heels, and the balls of the feet with the ground. Very gently, you want to just press your calves slightly back, not the knees, the calves, pushing back, and you want to pull your thighs up towards the hips. That is lifting the kneecaps, and that is at the same time bringing security to the knee joints. Okay, so the legs are quite strong. Full foot on the floor, slightly pressing the calves back, pulling up the thighs. Now let's talk about the pelvis. We want to keep the pelvis in a neutral position. So if you just imagine your pelvis like a bowl of water. When you stand like this, the water spills out in front. When you stand like this, the water spills out behind. No, we don't want that. We want to keep the water inside the bowl. Very gently, we pull the navel towards the spine. We relax the chest. The shoulder blades are going towards the center and down the back. And your head should be about the same line as your tailbone. Okay, so just slightly bringing the head back. We will be breathing in and out of the nose only. And we will make a small sound like the sea, like a sea wave. Yes, so let's just take a few breaths to find a nice rhythm together. So finding your position, strong legs, bowl of water, relax the chest, shoulders back and down, head in line with the tailbone, arms by the side. We're going to take a few breaths together. So inhale through the nose. And exhale through the nose. Make a small sound like the sea. Inhale. Exhale. Inhale. Exhale. Let's add some movements of the arms. So we inhale, lifting the arms from the side. We're going to interlace the fingers, interlace, pressing the palms up and the shoulders down, lifting out of the pelvis. On the exhalation, we will bring the arms back down to the side. With the breath, inhale. Interlace your hands, pressing out of the pelvis. Exhale. Again, inhale. Interlacing your fingers, press your palms up and your shoulders down, lifting out of the pelvis. Exhale. One more time with the arms from the side. Inhale. Interlace your fingers, press your palms up, the shoulders down, chin slightly into the throat. Lifting out of the pelvis and exhale, release the arms down by the side. We're going to do the same thing from the front. Inhale, lift your arms, raise your up from the front. Don't interlace, just lift out of the pelvis here. Drop your shoulders down. Exhale, bring your arms back down. Again, twice more. Inhale. Lift your arms up without changing the position of your upper body. Drop your shoulders. Exhale. One more. Inhale. Lifting out of the pelvis, drop your shoulders. And exhale, bring your arms down. So let's get the elbows involved. Again, we're opening with the arms from the side. We interlace, press the palms up. On the exhalation, we bring the hands behind the head. We inhale, open the chest. And on the exhale, we press the arms up like we press the sky away from us. And exhale, we bring the arms down in front. Let's do this twice more. From the side, inhale. Interlace. Press your palms up. Exhale, bring the arms behind the head. Inhale, open the chest a little bit more. And exhale, press the sky away and bring your arms down in front. One more time. From the side, inhale. Interlace, press your palms up, drop your shoulders. Exhale, bring your arms behind the head. Inhale, press the sky away. Exhale, bring the arms down in front. Okay, we're going to change a little bit what we will be doing. Inhale, lifting your arms from the side. Interlace your fingers and lift out from the pelvis. Now on the exhale, I will turn around. We will bend the elbows and bring your hands onto our shoulder blades. Inhale, we will open the chest, and then exhale again, pressing up, and bring your arms down. Once more. Inhale from the side. Interlace your hands, pressing up, drop your shoulders, lifting out of the pelvis. And exhale as you bring your hands onto your shoulders. Inhale, open the chest a little bit more. And exhale, push the sky away and bring your arms down. One more time. Inhale from the side. Interlace your fingers, press your palms up, drop your shoulders. Inhale, lifting out of the pelvis. Exhale, hands onto the shoulders, elbows as far behind you as you can. Let's stay here for 3 breaths together. Inhale. Exhale, press your elbows back just a little bit more. Inhale. Exhale. Drop your shoulders further back. Inhale, last breath. Open the chest a little bit more. Now exhale, push the sky up and bring your arms down in front. So just come back into our first position and just feel the sensations of energy in your arms. Energy circulating, blood circulating in your arms and your hands and your shoulders. Just take a couple of more nice and easy breaths. Let the body be strong and balanced, but comfortable. Long neck, we just breathe. Okay, let's work a little bit more on the chest opening. We're moving from the arms and the shoulders deeper into the rib cage and the chest cavity. So again, I will turn to the side so you can see what I'm doing. Okay, we're gonna inhale. We're gonna take the arms out to the side. On the exhalation, we're gonna bring the arms behind and grab our elbows. As you can, as comfortably as you can. Now on the inhalation, you want to like lean up and over your elbows, over your arms. Exhalation, come back to the front. We're gonna go 2 more times. Inhale. Open the chest, drop your shoulders, lean over your arms. And exhale, return. Once more, inhale, lift. Out of the pelvis, open the chest, strong legs, leaning over your arms. And exhale, return. Inhale, open the arms to the side. Exhale, bring your arms down by the side. We're going to do 2 more movements with the hands behind. Inhale. Exhale. Now interlace your hands behind and pull your shoulder blades down. Next, inhale, lifting out of the pelvis. And exhale. Try to go back a little bit further. Stay for 3 breaths. Breathing 1, 2, 3. Inhale, come up. Open your arms to the side. Exhale, bring your arms down. 3rd movement. Inhale, interlacing your hands over your head. Press your palms up. Drop your shoulders. We're going to go back 3 times. So inhale, lean back. Exhale, come back to the front. Twice more. Inhale, lift out of the pelvis. Leaning back. Exhale, come back to the front. Last time, inhale, lifting out of the pelvis. Open the chest, drop your shoulders, and come back to the front. From here, open your arms, inhale and exhale. Bringing your arms back down by the side. Okay. Next movement, we're going to take it further down into the waist. Lift your arms from the sides. Interlace your fingers, press your palms up. Now on the exhalation, we go through the right side. Exhale. Keep your arms long, pushing your palms away from the body. And inhale, coming up. Twice more. Exhale. Try to go a little bit further. Inhale, coming back up. One last time, then we will change to the other side. So exhale, press through the feet, press through the palms. Inhale, come up. And exhale, bring the arms down. Same thing to the other side. Inhale, lift your arms. Interlace, press your palms up, drop your shoulders down. Inhale, lift out of the pelvis. On the exhale, we bend to the other side. Inhale, lift. Relax your shoulders and the neck in this movement. Exhale, pressing through the feet, pressing through the palms. Inhale up. Exhale, third time. Try to just go a little bit deeper. And inhale, lift up. And exhale, bring your arms down by your side. So as you see, we're beginning now to stretch out the chest and the waist. Let's do a twisting movement. Inhale, we bring the arms to the side. Now on the exhale, we twist to the right side. Look at your back arm. Try to keep your pelvis as forward as possible. Strong legs. Inhale, come back to the front. Same side. Exhale, twist, go a little deeper. Inhale, come to the front. Exhale, twist, go a little deeper. Let's stay 3 breaths. Breathing 1. So each breath, you want to go a little bit further into the twist. 2, keep your pelvis as steady as you can. 3, and inhale, come to the front. Exhale, bring your arms down. We will do the same thing to the other side. Inhale. Exhale, twist. Inhale, come to the front. Exhale, twist again. Inhale, come to the front. The third time, we're going to stay for 3 breaths. Exhale. Now each breath, try to twist a little further. Breathing 1. Breathing 2. Breathing 3. Okay, and inhale, come to the front. Exhale, bring your arms down. Again, just find your center. Take a few deep breaths and just feel the energy moving in the body as we unlock each joint and the supporting muscles to the joints. So just take a moment of observation, observing your body, observing your energy. What has changed since we started? By observation, we understand why are we doing, what are we doing. Okay, so just drop your shoulders back, bring the head in line with the tailbone. Let's take another couple of breaths here. Breathing nice and easy. Okay. From here, we will go into Uttanasana subsequent movements. So again, I will turn to the side so you can see the movement fully. Okay, we're gonna again interlace our arms over the head with the inhalation. Drop your shoulders. Now on the exhalation, we go forward in a straight spine and we will do what Krishnamacharya called the number 7. So we want to look like the number 7 and we will inhale, come up again. Exhale, we will go again into number 7. Keep your legs strong. Keep pressing your palms forward and your shoulders relaxed. Inhale, come up. Exhale. Draw your belly button in slightly to support your lower back. Pressing your arms forward. And inhale, come up. And release your arms. Exhale. Bring your arms down by the side. Same movement with the arms to the side. So just inhale, take your arms out like wings. Imagine your shoulder blades. This is where the wings are. Spreading out all the hips. So open your wings, inhale. On the exhale, again, we come forward into number 7. Inhale, come up. Exhale, we will go again. Keep your spine as straight as possible, looking slightly forward. Inhale up. One last time, exhale. Coming forward. Pull your belly in. Spread your wings wide. Breathe. And then we inhale, come up. And exhale. Bring your arms back down to the side. Let's do the full forward bend, Purna Uttanasana, the complete forward bend. Take a deep breath, coming back into the center. And we're gonna start. Inhale, lifting the arms over the head. Press your palms up, interlace your fingers. Drop your shoulders. On the next inhalation, we lift out of the pelvis. We do one of those back bends we did before. And then exhale. We separate the arms and come into a forward bend. So bring the weight towards your toes. Bring your pelvis in line with your ankles. So come forward a little bit with your pelvis so that you can bring your head towards the knees. From here, we interlace. Inhale, we come up all the way, all the way, all the way. And exhale, again, we drop the arms by the side. Let's do this 2 more times. In the 3rd time, we're going to stay in the position for 3 breaths. So inhale, interlace your hands, drop your shoulders, strong legs on the exhale. Inhaling again, we're lifting out and going to a small back bend. From here on the exhalation, we come into number 7. And from number 7, separating your arms, coming to the forward bend. If you can't touch the ground, that's okay. You can leave your hands on your legs, or you can also slightly bend the knees. From here, head towards the knee. We inhale, interlace our arms, coming up slowly, 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 all the way, and we exhale, releasing our arms down. So as you understand, we start to work activating the hip joints now and the muscles of the legs as well as the knees. One more time. Inhale, interlacing your hands, pressing your palms up Drop your shoulders back and down. Exhale. Now inhaling again, lifting out of the pelvis, back stretch. And from here, on the exhale, we come into number 7 and continue from number 7 to go down into Purna Uttanasana. Let's stay for 3 breaths. So inhale, you want to soften your chest. Exhale, you want to strengthen your legs a little bit more. Bring the weight a little bit more forward. Inhale, release in the chest. Exhale. Little bit deeper. One more time. Inhale, open the chest. Exhale, head towards the knees. And then inhale again, interlacing your hands. Coming through number 7. Lifting up all the way. And exhale. Release your arms down. Okay? Take a couple of breaths here before we move on into some other variations with the arms in the forward bend. Okay, so on the inhalation, inhale, bring your arms to the side. Now as you exhale, we're going to roll the palms upwards, so the shoulders roll forwards as you come into the position. So here, let your arms just hang from the shoulders, head towards the knees. We're going to stay for 3 breaths. Breathing 1. So let your arms feel heavier and heavier with each breath. 2. 3. And then inhale. As you inhale, roll your palms back up towards the ceiling and bring your arms down to the side. Let's do 2 more variations of the arms in connection with the forward bend. So inhale, bring your arms to the side. On the exhalation, interlace your hands behind you. Now inhale, we open the chest as we did before. And on the exhalation, we go through number 7, flat back. And we come into the forward bend. And again, we bring our arms forward. Heavy arms. Let them be heavy. Let your shoulders be soft. We stay for 3 breaths. Breathing 1. 2. 3. And then from here again, we come through number 7 on the inhalation into full standing and just release our arms by the side. Okay. 1 more. Inhale, bring your arms out to the side. Exhaling, grab your elbows behind your back. On the inhalation, lift up and over your arms. On the exhalation, coming forward. Now keep your chest open and your shoulders and your elbows back. So this forward bend is more about opening the chest, releasing the shoulders, and keep your legs strong. So let's do a half lift here. So inhale, open the chest, lengthen the spine. Exhale, going a little deeper. 1 more time. Inhale, lengthen, open the chest. Exhale, go a little bit deeper. And on the inhalation again, we come up through number 7, all the way into standing. Drop your arms by your side. How are we doing until here? How's your body? Feeling a little bit more energized, I hope. Okay, so let's combine some of the movements again we did before. So interlacing your arms, inhale, lifting up, press your palms up, drop your shoulders, lifting out of the pelvis. Now exhalation, we do a twist to the right. Now inhale, we come into a slight back bend. And exhale, we lower the upper body by the side of the feet. So we're doing forward bend, but we're doing it at the side of the legs. From here to come back, we inhale, lifting from the sides, coming back into the back bend. Open, 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 and exhale. Return to the front and release your arms down. Let's do this to the other side. When you're ready, inhale, interlace your hands, press your palms up, drop your shoulders down. On the exhale, twist to the left. Now inhale, open the chest more, looking up. On the exhalation, we bend down and we put the arms on the floor beside the feet, head towards the knee. Coming out, strong legs, push your feet down. Inhale, inhale, inhale. Come back up into the back bend. Relax your shoulders and the chest and exhale. Return to the front and arms down to the side. How is that? Probably you cannot see fully all my arms when they're extended, but no, they're just interlaced over my head. Okay. Let's do it once more on each side. On the inhalation, interlace your hands, press your palms up, drop your shoulders down. On the exhalation, twist the upper body to the right side. Drop your shoulders even more. Inhale, lean back, open the chest. Exhale, bring your palms to the floor by the side of the right foot. Head slightly towards the knee. Now strong legs pressing through your feet, pressing through your palms as you come up. Into the back bend. Open the chest. Exhale. Return to the front and release your arms down. Take a deep breath in the central position. And we will do the other side. So inhale, stretching up. Interlacing your palms. Push up a little bit more. Drop your shoulders. Exhale, we will twist to the side. Inhale, open the chest a little bit more. And exhale, bending down, bring your palms to the side of the feet. Head slightly towards the knees. And we're coming up, pressing through the feet, strong legs, strong legs, strong legs, strong legs, coming into the back bend. And exhale, coming back to the front. Release your arms down by the side. Okay, let's do a quick check-in. Again, I want you to just observe your body and your energy circulation for a moment. How does it feel now in comparison to when we started the session? A couple of deep breaths through the nose, fix your position again so your body is completely aligned. Okay. Now what is left to activate is our knees and our ankle joints, just a little bit more. And then we have completed the whole body. So I will turn to the side again. Okay. So we're going to start again with the arms going out to the side on the inhalation. Drop your shoulders, spread your wings. Now on the exhalation, I want you to squeeze your inner thighs. Squeeze your inner thighs, keep the knees together and pull your belly button towards your spine. So we're just going to lower halfway down. Okay, inhale. Press through the feet, coming back up, and exhale. Bring your arms down. Let's do this 2 more times. And the 3rd time, we will stay for 3 breaths in the position. So inhale. Open and spread your wings. Belly button goes in. Keep your legs together, squeezing inner thighs. Exhale. The weight now is in your heels. Inhale, pressing through the feet, come up. Exhale, bringing your arms down by the side. 1 more time, and we will stay some breaths. So inhale, spread your wings wide. Pull your belly button in, relax your shoulders, squeeze your inner thighs together. The weight is in the heels. Try to look relaxed. Smile. Breathing 1. Holding the position. Squeeze your inner thighs. 2. 3. And inhale, pressing through the feet. Exhale. Bring your hands by the side. We will do 1 more variation with the arms. Inhale, lift your arms up. Interlace your fingers, press your palms up, drop your shoulders down. Exhale, bend. So keep a nice line through your arms and the upper body. Inhale, press up. Let's go straight again. Exhale, going down. Inhale, press up. 1 more time. Exhale. Stay for 3 breaths, looking slightly forward or towards your arms. Breathing 1, 2, 3. And inhale, pressing through the feet. Exhale, release your arms to the side. Take a few breaths here, just 2-3 breaths to again fix your central position. Observe your body, observe your energy circulation. Let's attempt to do full squat, Purna Utkatasana, where we're trying to bring the buttocks as close to the heels as possible. So this one we will do with the arms in front first. So inhale, raise your arms in front. Drop your shoulders back. Pull your belly button in slightly. Be ready. On the exhale, we will go down. Go down as far as you can go down. Inhale, pressing through the feet. Come up. Let's do twice more. Exhale. Going down, going down, going down. Inhale. Pressing up. Exhale, going down. Now we're going to try to stay for 3 breaths. Relax your shoulders. The weight is in the heels. Keep your legs together. Breathing 1, 2, 3. And now inhale. press through the feet, come up. Exhale, bring your arms back down by the side. One more arm position. Inhale, arms to the side. Exhale, we're going to grab our elbows again. Now try to keep your chest open as you go down into the full squatting position. Inhale, just open the chest, lift up. Draw your belly button in, exhale. Inhale, come up. Keep your chest open. Exhale. Inhale, come up. Pressing through the feet. Exhale. Staying for 3 breaths. Drop your shoulders back, elbows back. Breathing 1, 2, 3. And pressing through the feet. Inhale, come up. And exhale. Release your arms. Back down to the side. Okay. Take a couple of breaths. Breathing nice and easy. Okay, so now we're just going to combine both the forward bend and the squatting pose into a movement. Okay, so we start. Inhale, open your arms in front. Drop your shoulders back. Exhale. Going down. Okay. Then inhale, place your hands onto the floor. Exhale, come into the forward bend. Head towards the knees. Interlace your arms. Inhale, come up through number 7. And exhale, bring your arms back down by the side. How did that go? Twice more. Inhale, arms come out in front. Exhale, go down as far as you can go down. Inhale, place your hands on the ground. Exhale, pressing up into the forward bend. Head towards the knee. Interlace your hands. Come through number 7. And exhale. Bring your arms down. One more time. Let's go. Inhale, lift your arms in front. We're going to stay now 3 breaths. Breathing 1. Strong center. Weight goes into the heels. Relax your shoulders. 2. 3. Release your hands down. Inhale. On the exhale, press your hips towards to the ceiling. Staying 3 breaths. Breathing 1. 2. 3. And interlace your fingers. Inhale. Staying 3 breaths in number 7. 1. 2. 3. And inhale, lifting up all the way. Exhale, releasing your arms down by the side. Okay, let's do a couple more postures that mobilize the spine, and then we will do some relaxation. Okay, so interlacing your arms over the head. On the exhalation, open your feet a little bit more than your hips. Now inhale, drop your shoulders, open the chest. On the exhale, come down. Okay, now grab your legs from the inside around your heels or around your calves. We're going to just open the chest, lengthen through the spine, number 7, strong legs, and exhale. We're going to come into the standing turtle. Pull yourself towards the legs. Elbows are facing the side. 6 breaths here, breathing 1. 2. 3. 4. Keep breathing. Very important. Continue to breathing. 5. 6. Okay, now from here, interlace your hands. Inhale, come up. Exhale. Arms down by the side. Keep the legs open. If you want, turn them a little bit outwards from the hips, if it gives you a better stance. We're going to go now into the opposite direction. Okay, we're just going to do, we're not going to go back all the way. We're just going to do a back bend, which is suitable for any level. Okay, so we're going to interlace. No, we're not interlacing. Inhale, we bring the arms to the side. Exhale, I want you to bring your hands onto your lower back and the elbows back and the shoulders back. Inhale, open the chest, drop your shoulders, relax your shoulders, keep your legs strong. Exhale, push your pelvis a little forward and look back. 3 breaths. Breathing 1, 2, 3. Okay, and inhale, coming up, raising your arms out to the side. Exhale, bring your arms down. So the legs still are open. Okay. Let's do a second one. So you either do the same one again. I will go a little bit deeper for the second one for those who want to give it a try. All right, so we inhale. On the exhale, now leave your hands at the lower back. Inhale, open the chest. Exhale, go back. Okay, now either stay or walk your hands down your legs a little bit more. Soften the knees. And inhale, come up. And exhale, stand. We're going to do this a couple more times. Inhale, open your arms to the side. Exhale, come into the back bend. So you have to keep your knees soft. Don't lock your knees. Open the chest. Relax the shoulders. Soften your knees. Bring your hands a little bit further. Keep walking down towards the knees. Breathing 1, 2, 3. And lifting up, walk your hands back up. Inhale and exhale, drop your arm down. Can we manage one more time? Keep your hands on your lower back if that's the more comfortable for you. For those who feel comfortable to walk the hands a little bit further down, go for it. But keep breathing. All right, here we go. Inhale, arms to the side. Exhale, arms to the lower back. Elbows back, open the chest. Inhale, lift out of the chest. Exhale, bend. Start to soften your knees. keep your pelvis forward. And either stay or walk your hands down. Breathing 1, 2, 3. And walk your hands back up to the lower back. Inhale. Coming up. Exhale, drop your arms to the side. All right, and let's bring the feet together. Find our central position. Let's do a couple of asana to relax all the joints and relax all the muscles a little bit. Inhale, interlace your arms over the head. Exhale, come through number 7 into forward bend. Now, keep your feet together. Just open your knees to the side so you're squatting over your feet. Okay? Now you can either leave your hands in front or you can turn your palms over and grab your heels. Now press your arms into the knees so your spine lengthens forward. So let's stay for a couple of breaths here. Breathing 1, 2, keep lengthening the spine forward. Keep opening the chest by pressing your arms, your shoulders into the knees. 2, 3, 4, 5, 6, and release. And we're just going to come into sitting, Paschimottanasana. We're going to extend the legs in front. Keep the legs slightly open. Inhale, we're going to interlace our arms, pressing the palms up to the ceiling. And then exhale, open your arms, drop your shoulders. Inhale, lift. And exhale, leave your hands on top of your feet. And just let the head go down towards the knees. Let the body relax now. Relax your shoulders. Relax your neck. Keep the legs relaxed. Relax your spine, your lower back. Let the head hang heavy. We're going to stay for a few breaths here. I'm not going to count. I just want you to follow your breath and to let the body relax with the breath. Just breathe. And if you can go deeper, go a little deeper. Couple more breaths. Okay, and then from here, we're coming back up. Coming back up into straight spine. Leave your hands on your thighs for a moment. Just again, observing your body, observing your energy circulation. Observing again what is feeling different now in the body. What has changed? All right, and we're going to just do one more position lying down to relax all the joint and bring the spine back to its natural curvature. So I want you to just lie down. I hope you can still see me as I'm lying down. Okay. And we're going to just bring the soles of the feet together. Supta Baddha Konasana. Let your knees fall to the side. Bring your arms over your head. Again, we grab our elbows and we let the arms come to the floor above our head. Now relax your shoulders. Feel your shoulder blades on the floor. So your spine naturally will not be completely flat on the floor. And this is perfect because we're bringing the spine back into its natural curves. At the same time, we're relaxing the shoulder joints, we're relaxing the neck, we're relaxing the elbows and our hands, we're relaxing the knees, the ankles, and the hips. And I want you to relax your belly too. And breathe into your belly. So you're basically feeling the movement of your belly going up and out on the inhalation and coming back in on the exhalation. So feel your belly moving up and down in rhythm with your breathing. So inhale, filling your belly with air, and exhale from the mouth. Inhale, filling your belly with air. Exhale from the mouth. A few more breaths. Inhale through the nose, filling your belly with air. And exhale from the mouth. 2 more times. Inhale. And exhale. Inhale. And exhale. Inhale. And exhale. Okay, just relax your breath now as you let your body relax. Natural breath. And gently we will bring the knees back together to the center. And we're going to bring the knees into the chest. Place your hands on top of your knees and just with the exhalation, pull them gently into your belly. And we're going to do some small circles. So the hands are guiding the knees, drawing circles in the air. So it's like a massage for the lower back. Okay, to release any stuck energy from the lower back. Okay, and since we were doing most of the position standing, lift your legs in the air. You can leave your knees soft and just let your legs become very light, very relaxed. So even here you can move your legs just a little bit from side to side. So you still get that massaging effect for the lower back. Let your legs become very light. So let's all the blood, let it go back to the heart center. So when you stand up after this, your legs will be filled with fresh blood. Okay, so we just let the legs relax. Crack your toes, wriggle your toes, move your ankles. shake out your legs a little bit if they feel very heavy from all this standing. And then let your feet just drop down to your buttocks. We're going to roll to the side. And we're going to come up. We're going to just sit on our heels as good as you can. Okay. If you have problems with your knee joints or you're not comfortable sitting on top of your heels, you may also just sit down on the floor with the legs crossed. Placing our hands on our thighs, so this helps us to ground and come back. You may close your eyes for a moment, and I just want you to follow your breath for a moment, again observing the body, observing your energy. What has changed in the body, in your energy, since we started the session? What is the difference that you feel? Just observing, being aware of our body, of our joints, of the blood flowing in the body. Relaxing your chest, your shoulders, your neck and your face. Just following the breath. The hands on our thighs. We're doing it in order to ground ourselves. Again, after the practice. Just a few more breaths. Allowing the body to absorb all the benefits of the yoga asana that we did. Very nice. Just feeling the body, feeling the breath. All right. And on the next inhalation, I want you to lift your arms up, bring your palms together, stretching up. And then we're going to draw that energy down into our third eye center. I'm wishing everybody clear thoughts and a strong mind. Exhaling again. Bring the palms over our lips. I'm wishing for everybody to speak kind words to oneself and to others. Exhaling again, we bring the palms over our heart center. I'm wishing for everybody a lot of love, compassion, kindness. And let's stretch out the arms once more. And then coming forward, bring your hands onto the floor. And here I'm wishing for everybody to release any tension, any stress. Release anything that you don't want to keep. Letting go. Letting go. Letting go. Namaste. Namaste. Thank you very much. Thank you.
Thank you, Marita. It was a wonderful session. I hope participants have learned a lot of things from your experience.
I hope it was fine for everybody. I hope you enjoyed it. Thank you, Depti, for your comment. I just saw it now. Unfortunately, I can't see your comments during the practice since I was away.
No problem. It was a
But,
great session. Great session. Yes. So it was an amazing session. Is there any question? Perfect. So since there is no question here, Marita,
I hope you enjoyed. Have a nice evening, everybody. Thank you for your invitation.
Yes. If anyone wants to
be here,
ask or get in touch with Marita, we will be sending you her Facebook link and Instagram link. So you will get recorded session too, and you can get in touch.
Yes, please practice this again. As you maybe feel the difference, it's an amazing session to just open up all the joints and the body when we feel very tense and stiff. So I hope you enjoyed it. And yes, please do practice this again if you liked it.
Thank you, Marita. Marita, I'll be setting you in the attendees list so that you can attend the rest of the sessions. Next session is of Swami Tapunidhi. It is. Thank you, Marita.
Hari Om Tat Sat.
Sir, very good evening and welcome. It was the one of the most awaited event of the day. I have been getting requests throughout the day for this event, sir. Allow me to introduce Swami Tapunidhi Ji. Swami Tapunidhi Ji belongs to a traditional Bihar school of yoga, and he is spreading the word Nada Yoga across the globe. And I will not waste again his time and allow him to take the screen to deliver his wonderful session. So please continue. Thank you.
Hari Om Tat Sat. Getting ready to begin. Before we begin, settle your body comfortably in a posture of your choice. Relaxed posture with the spine, neck, and head upright and aligned. Placing the hands comfortably in the posture of in the mudra of your choice. Eyes softly and gently closed. Bring the focus of your attention to your breath. The flow of the breath through the nostrils. As you inhale through both the nostrils, you breathe in up to the apex of the nose, the eyebrow center. And in exhaling out, you breathe out through the nostrils, triangular breath. Stimulate the eyebrow center. Maintaining the focus of attention on the eyebrow center. To chant the mantra Om with me 3 times, inhale deeply. Om. 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 Om Shri Gurubhyo Namaha. Om Shanti Shanti Shanti. Hari Om. Rub your palms vigorously, palm your eyes, open your eyes within the palms. I take this opportunity to thank Dr. Ruchita Shah, Dr. Gaurav Pant, the conveners, Bharati Vidyapit, Pune, for inviting me to join with you all on this journey of yoga, celebrating the journey of yoga through this festival. Let's open our hearts A festival is a place to open our hearts and connect with each other. The subject matter which has been given to me is Nada Yoga. I would like to mention something about the word yoga. After every chapter of the Bhagavad Gita, it states, Om Tat Saditi, Srimad Bhagavad Gita Su Upanishadsu, and then it says, Brahma Vidyayam Yoga Shastra, Brahma, consciousness, Vidyayam, to attain the knowledge, Vidya, knowledge, Yam, to attain the knowledge of consciousness, Yoga Shastra, through the art and science of yoga. Let us keep this as a base in mind as the purpose of yoga. We are on this journey. At the moment, our expressions of life are based on impressions and instincts. My left hand, impressions and instincts. They are guiding our life, our behavior or an action through emergence of thoughts within the mind. The journey from this instinct and impressions has to go to intelligence. Intelligence draws the inputs from the buddhi, draws the inputs from the impressions, instincts, or it can draw from intuition, purusha. So this intelligence is discriminative intelligence. And Patanjali Yoga Sutras are very clear about this. Viveka Khyati Hanno Upaya. We have to cultivate discriminative intelligence. And the next sutra says, Tasya Saptada Pranta Bhumi Prakyaha. To go to the different states of knowledge, through the 7 steps of knowledge. To go to intuitive knowledge. Knowledge which is beyond the senses. And from there to connect with the divine knowledge. And when the union of the divine knowledge is there, at that point of time, there is a fusion, there is no object, there is no subject, there is only energy remaining. On this journey of yoga, we are on this path. Coming down to Nada Yoga, we are adopting many practices, Hatha Yoga, Raja Yoga, Kriya Yoga, Karma, Gyan, Bhakti, all may be integral altogether also. The purpose remains as stated above earlier. We come to Nada, N-A-A, Na, plus the constitutes Na, the. I want to explain this to you by an example. Consider a stringed instrument. A stringed instrument, when plucked, the string, when it is plucked, vibrations are created and a sound is generated. Now this stringed instrument is in a space which contains air. Let us be very clear about this very important aspect. If the string instrument was in a space where there was vacuum, and even if you pluck the string, would there be vibrations? Would the air vibrate and carry the vibrations to your ears and you listen to the sound? So the word na relates to space and the air contained in it. Now the Vedas, my Guru Swami Niranjananda Saraswati, he used to always remind us, Kham Brahma. The Brihad Aranyak Upanishad, section 1, 5.1.1 says, Om Kham Brahma. Om is come, Om is Brahma. Come, Brahma. The word come relates to space with air within, with prana within. We all know about the mantra, Om Khagaya Namaha. Om Kha, space, Ga, Khaga, is a traveler. Here, one who travels in space, that is the sun, and we bow down to him. What I'm trying to bring out is that Kham, Brahma, Kham is the field of consciousness. It is the field of potential. It is that place which is full of prana, full of air. And this is a prerequisite. So, Brihadaranya Upanishad states in this 5.1.1, Om Kham Brahma, Vayuram Kham Iti Hasmaha. It contains air. And if you know this, the next statement is, if you know this space, then you have all knowledge, access to all knowledge, intuitive knowledge, knowledge beyond the senses. So this word NAA, na, the syllable, indicates the field of consciousness with prana. Prana that is always oscillating, always vibrating. This concept has to be very clear. And it is here where the air is there, where the prana is there, that is where the da comes in. The very word da, when you listen, it is as if you have been struck. So the word da is the strike, is like a pebble which you throw in a still lake and vibrations are created. So though the na and the, they have different meanings, but as a combination, the meaning totally changes. Na, potential, energy. The, dynamic energy, kinetic energy. Ichha Shakti. We have a desire and it strikes and there is a vibration. The moment you have a desire, a thought is created and action is there. If a thought is there, I'm thirsty, I will go and have a glass of water. And that is where we come to the word na, the. The word nada means dhvani, vibrations. Vibrations are created. Those vibrations may be audible or inaudible. When they are audible, nada. And they can be vocalized, goes down to swara. And the science of music goes down further to shruti. We will not dig so much into the detail of it. But just to bring to your mind that the word nada indicates dhvani and nada, vibrations and sound. It is indicative of prana which has been activated. And it is this prana which is responsible for this entire being. Look at it a little bit differently. Nada is struck. Activity. Bija, seed. There is a bija, Ardhanareshwar, Paramashiva, in a harmonious state. There is an Ichha Shakti, Ekoham, Bahushyama, activity. That bija, Kala, Nada, Bindu, Kala. So this Kala and bija, also known as bija, generates Nada, the vibrations, the flow of consciousness. Once this idea is very clear, then the background which I have given about yoga comes in over here. Again, space is Brahma. Nada, yoga, for accessing the different states of consciousness. How are we related to Nada? What is the relationship between a human and vibrations? If you smell an aroma or any of the tan matras, you are receiving a vibration. You like it or you don't like it, but you have received a vibration. You receive a vibration and it gets translated into images, symbols, impressions. It does not stay as a vibration, but when it is restruck again, it comes up as a thought, as a memory. Our body is a body of vibrations. Every cell in our body has a proton, neutron, and electron. Every cell, every atom in our body. This entire being is related to vibrations. If somebody shouts at you, it is a vibration. If somebody is pleasant to you, it is a vibration. This has to be very clearly understood. We are connected through vibrations. Now let us look at this concept of nada. You can take up any yoga, say hatha yoga. Ha and ta, mantra, pingala nadi, the vibrations through the pingala nadi, the energy through the pingala nadi. Tham related to ida nadi, the vibrations through ida nadi, the ida energy, the pingala energy. Hatha yoga is not away from nada yoga. Let us go to Raja yoga. You are stilling the vibrations of the mind. Yoga chitta vritti nirodha. You are guiding atha yoga anushasanam. You are guiding the vibrations. You are guiding your thoughts. You are guiding the vibrations. How to manage life. How to manage your expressions of life. Through mind management, through vibration management. Look at Kriya Yoga. You are moving the energies within the spinal passage, clearing the Sushumna, and stimulating the different centers of the brain. And then going to Kundalini Yoga, again, energy, vibrations. No yoga is without Nada Yoga. And that is why I was very glad and thankful that they have given me such a topic which nobody wants to talk about. It is the key to the practice of yoga. Pick up any yoga. This is the key to the practice of any yoga. Going a step further, we have discussed Nada. We want to discuss yoga and Nada together. Nada yoga. What does it mean? We started with a harmonious state. Shiva and Shakti, space. That harmonious state, we want to attain within us and in the external environment also. This has to be understood very clearly. We want to attain harmony and balance in our expressions of life, by which everything around us evolves and we also evolve. And that is why this journey, that's why I said this as a journey of yoga. We are all together in this festival, BreathLYFE festival. We are all together on this journey for evolution, for evolving from instinct and impressions to discrimination to different states of consciousness, to be able to guide ourselves. What are the tools of yoga? This is related to yoga, so I'll be talking about the tools of yoga. Nada yoga As I have already explained just now, it is related to our attaining a harmonious state of being within and externally. Next, the tools of yoga. Let us begin with the breath, the Ujjayi breath. The Ujjayi breath, natural spontaneous breath, which can be experienced with awareness. Natural spontaneous breath, when connected with awareness, becomes Ujjayi. The Ujjayi breath has a sound. You tune into the sound and you tune into the Gayatri of the mantra of the breath. The Soham sound, one of the highest mantras. Let us understand this thing very clearly. The Soham mantra of the breath is happening 21,600 times, 24 hours a day. Whether we are aware of it or unaware of it. Which means the vibrations of the breath are also continuously there, existent. We are not making it happen. And this can lead us to Nada Yoga, that sound which is unstruck. We are talking of struck sound now and unstruck sound. So you are listening and tuning in to the vibrations of the breath can lead you to the unstruck sound. This is specified as an ajapa jap dharana, Ujjayi breath, psychic passage, psychic sound. So you create this psychic passage. The most important psychic passage is the Sushumna. So now when you are creating through Ujjayi breath, going up and down your awareness and the vibrations together, key point, concentration and the energy, they both go together. And that is what gives us the ability to tune in to that particular mantra, Soham. The Bhagavad Gita has stated, the Bihar School of Yoga, the founder, Swami Paraman Swami Satyanand Saraswati Ji, he used to say, become a practitioner of Ajapajap and you don't need a guru. You can attain, provided every moment you are with your breath. Kham Brahma, you can attain. You have the knowledge of Kham, you have attained. Ability to access the different knowledges, ability to access the knowledge which is beyond the sensorial impressions. So Ujjayi breath can take you to the psychic centers, the chakras. The chakras are the psychic centers. They are receivers of energy and they are distributors of energy. It is the same energy which is used to stimulate the chakras. Again, Ida and Pingala, they meet at the chakras. So you're using concentration and energy. So in the practice of chakra meditations also, mudras are used to direct the energy to the particular chakra, and the Bij mantras are used. Bija. Bija is a seed, a potential, which when flowers, a whole tree is there. The tree is not visible at the moment, but it will manifest as an external expression. That is what Bija is. It's a seed, a powerful seed. Let me explain this a little bit differently. There's a neutron. You take a neutron, you fire it at a plutonium, what happens? The plutonium splits with a huge surge of energy. And that energy needs to be controlled and directed. That is why discrimination, viveka, is important. So on the journey of yoga, when you're exploring the chakras, then the first chakra is to be awakened is the discriminative faculty, the intuitive faculty, the ability to be aware, the jnana chakra, agya chakra, and then you proceed to the other chakras. So this is about Ujjayi Pranayam, how Ujjayi Pranayam is helpful in Ajapajap Dharana, how it can lead you to the different centers. There are 5 phases of it. Psychic breath, Ujjayi, psychic passage, psychic sound, psychic center, and psychic symbol. It appears as a symbol, a geometrical design, a yantra. A Japanese scientist has already discovered that water molecules, they form a definite yantra within the body as memory. So that is exploded. You free the mind of the memory and delve deeper to plant another seed in the field of your consciousness, a totally new you. Going to the second practice of yoga, for Nada Yoga. We are all familiar with the Brahmari Pranayam. The Brahmari Pranayam can lead you to, for Nada Yoga, Shanmukhi Pranayam. The same Brahmari Pranayam, but you are closing in the 7 gates, 2 eyes, 2 ears, 2 nostrils, and the mouth. And you internalize. And if you close the 9 gates through Vajroli or Sahajoli for the ladies and the Ashwini Mudra, then you close the 9 gates and you internally start hearing the different types of sounds, which can ultimately lead you to Anahat Nada. Simple practice requires practice. Please understand this thing. Practice is something which is to be done, whether you like it or not like it. You have a belief system, please maintain it. You're having food every day, fixed time. Similarly, practice is a must. That is the path of progress. The mind tires you. I don't want to do it today. I'd rather rest. I want to have a smoothie. I want to have a pizza. Yes, all attractions are there. Practice under any conditions. Satu dirghakala nirantarya satkar sevito dhrida bhumi. It becomes the foundation of delving deeper into the states of consciousness. Let us go to the other practice of bija mantras. Mantras. Manna tatrayate iti mantraha. Mantras, bija mantras. Soham. One is the Srishti Bija, creative, that which creates. And the other is the Samhar, that which takes you back up, destroys your creation and internalizes your energy. What is important is so, her, and the bindu, dot, so, so. It has become hamso. The mind dissolves and soham becomes hamso. Hamsa, it is one of the highest mantras. Mantra sadhana. How does it work? Let us look at the Sanskrit syllables. I hope I'm able to share the screen. Yeah. Okay, fine. I'm unable to share the screen. Anyway, you see, we talked of swaras. There are swaras which are known as a, I, u, a, and they are striking the different points within the mouth. Starts with the guttural, the throat, then the palatal, then the cerebral between center of the mouth, the retroflex, then the dental, the p, p, k, k, ch, t, t, and p. It starts with a coming from the throat down below. Now these, they have this Now if you say ka, in English it is written as k plus a, then it becomes ka and pronounced as ka. A is for the Akash Tattva, the Prithvi Tattva, and connecting them is the Makara. When both are closed, closed. Now, when these Sanskrit syllables are chanted as mantras, they are stimulating the different centers within the mouth, which have got connection with the brain. So many nerves. And they blast. Ka, kha, ga, ga, na, ka. These are the varnas. And then kha, ka, kha, ga, ga, cha. So that comes to the palatal. Ta, the third 5 letters. They come to retroflex, cerebral. And then it goes to dental, ta and pa. And there are semi-vowels, ya, ra, la, and va. Yam is the Bij mantra of the air element at the Anahat Chakra. Ram is the Bij mantra of the Manipur Chakra, the fire element. Lam is the Bij mantra of the root chakra. Vam is the root chakra. And Hum and Sham, they are the 2 mantras of the Ida and the Pingala. Want to take a trial? Let's chant. Kam Sham Tam Tam Pam Yam Ram Ham Sham Om Yam Ram. And this is how it goes, the entire cycle, beginning into the Kriya Yoga practice or cleaning the entire psychic passage. So these are the sound syllables. Sanskrit language, that is why it is known as the language of the gods. And the gods are energy. They are a personification. When we say some particular god with a figure, it is a personification of an energy, a type of energy. So that is about the energy created through these vibrations. Nada, the Bij mantras. Bija, seed, a potential. The potential which strikes When it strikes with activity, vibrations are created, the flow of consciousness is there, and creation happens. Now there are 7 bindus: Mooladhar, Swadhisthana, Manipur, Anahat, Vishuddhi, Agya, and Sahasrar. These bindus have their own bija mantras. The bijas. This goes into the musical scales also, the swaras. The 12 notes, Saregama Padhani Sa, 7, Saregama Padhani, 7, and the higher notes, 5 of them, 12. And when they turn into Shrutis, they go into 22. And it is around 3 notes, the high, the low, and the connecting in between, which is the Udat, Anudat, and Shruti. That is what connects, and that brings your mind, to a state of calmness. We have all known about beta, alpha, delta, and theta waves. It is when these states, when you chant the mantras, when you chant the bijas, that the mind goes into the state of calmness. It gets entrapped into a lower frequency between the high and the low. When it gets entrapped into the lower frequency, that is when the different activities of the brain are stimulated. Either it is creativity, or it is ability to cure yourself, going into an anxiety-free state. These become the key point of Nada as a yogic practice. It affects the brain waves through entrapment into a lower frequency. This has to be understood very clearly. The practice of Nada is today in yoga practiced even with the singing bowls. And that is an art, how to strike 2 singing bowls to bring the mind to a state of lower frequency. When that frequency sets in and your mind gets entrapped into that, calmness sets in. And the first result of it is health. It is a byproduct, but it is the first result that you attain health, you attain calmness. Consciousness moves the energy to the point where it is required. Healing happens through this in a very big way. Ham mantra is the mantra of the Vishuddhi chakra. It is also the mantra of the Pingala Nadi. But Ham mantra, when chanted specifically with attention on the Vishuddhi, and that art has to be learned from a skilled teacher, you will find so many changes happening. The problems of the throat, the problems of hearing, ENT, they start solving themselves. That is what stimulation means. So in the practice of Nada Yoga, mudras are also used to direct the energy along with the Bij mantras and the focus of attention. Bij mantra activates, awakens the mudra will stimulate that center with your attention over there. When the opposites meet together, hot and the cold, when they meet, opposite energies meet together, there is an explosion. And whatever explosion comes about, that energy has another bija, another thought, another idea that can be utilized either as a practice of karma, action in the external dimension, or that can be sublimated to another level of consciousness, which is known as Kriya Yoga. Karma and Kriya, they have the same root, Kri, energy, action. The action can be internal through Kriya. The action can be external through karma. And that is why it is very important to awaken the Agya Chakra first. For example, in case Swadhisthana gets stimulated and you are not aware in your daily life that you are running from one softie, one smoothie to another place for another food, to third place, and you are giving way to your desire. In fact, you are slipping away from the goal of yoga to go higher up the consciousness, to go to the altered states of consciousness. This requires management. It's a very deep practice of Nada Yoga. So we have talked of Ujjayi breath, we have talked of Brahmari Pranayam, we have talked of mantras, bijas, and even kirtans, bhajans, songs, etc. They center you. You become focused at one point, and it is from that point onwards that you can go into a state of what is known as bhava samadhi through kirtans. Kirtan is a very important practice. You are clapping with the kirtans. And then the state comes when the energy within starts dancing and you feel like getting up and you start dancing. So this has to be understood that any yoga you take, all the yogas are connected through energy. And it is this energy which is very important to control and guide. You want to sublimate it or you want to use it. In this 1 hour session, I have tried to introduce to you very simple concepts through an example. I would like to open this now to question and answers, because the practices to be practiced have to be face to face to be able to see what is actually happening. I talked of a little bit about Om Mantra, highest nada, anahat nada, the vibration of the universe, the vibration of the sun as recorded by NASA. It does not use the tongue. Tongue is not required to utter Om. It comes from here, it comes from down below, it rises up. Om, Om. So you form a beak and you are closing the beak, it goes into U and it becomes Ma. Om. Setting up vibrations within. The key point over here is the energy which in our normal life is downward and dissipating externally. In Nada Yoga, The energy is inverted, it is upwards and concentrated. Reversal of energy, yoga. Understand the word yoga over here very clearly. Going back to the source. The source of this universe is nada, is vibration. First there was the word and the word was God. All the scriptures say this. How we use this in our life. And there are so many different traditions. There is Sufi music, there is Sufi tradition, there is Kabir tradition, there is yoga tradition, and they all deal with, there is a tradition of so many other practices. This is a background of yoga, how we can, how nada, of how you can utilize nada in our daily lives. Here I would like to stop and open up for question and answers. About 9-10 minutes are left. Can we have the questions, please?
Swamiji, there is a question by Deepti Jain. She said would like to learn more about Nad Yoga and singing bowl. Please suggest. A question by Deepti Jain.
There are schools over here which are teaching about Nad Yoga. There is a school in Calcutta which is even manufacturing this bowls and things like that. And they have regular courses also. And you can click on Shruti Nada Podar. She is also giving good lessons on Nada Yoga. And just to elaborate on this subject, please understand this thing. I have talked of these 7 chakras, but the Shakta Sampradaya, the Shakti tradition, they have Reem, Leem, Kleem, Eem. They are the different centers and they have 9 centers. They are not talking of 7 centers. They have 9 triangles. They have 6 chakras up to Agya, then 2 more over here, and then the 9th one over here on top, which is the 7th one for yoga. So even the Shakta tradition is calling of this thing. So you can click either Shruti Nada Podar or you click on Calcutta Yoga sound healing, and maybe you'll be able to access these people who are running the courses on Nada Yoga. And they can be really very extensive and in-depth. And they will teach you about singing bowls also. Any other question?
Thank you. Ruchita Shah, it is very inspiring, Swamiji, to the point yet with lots of enlightening depth, blissful. Thank you, Ruchita ji. There's a question, how many chakras are there in total? Well, many people get confused regarding chakras since you have mentioned it, sir.
Well, let me say one thing very clearly. It's a very deep question. I would say that we are dealing with 7 chakras at the moment, but there are minor chakras. Yeah, there are minor chakras and it can go up to 114, 108, 114 also. So I would suggest 104 also. So I would suggest practice is more important than finding out how many chakras they are. We know the 7 chakras. Let us focus on them.
Right. Swamiji, I believe you also teach Nada Yoga.
I conduct sessions on Nada Yoga
So
for experiential purposes and not as a taught subject. I conduct sound vibrations and also give vibrations through different other techniques. And I conduct those sessions as chakra meditation retreats.
So Swamiji, what we will do, we will send your contact detail and links to our participant when we are sending them certificates so they want to contact contact you directly. There's one more question came up. Sir, any book would you like to suggest for us in terms of Nada Yoga?
There is, you say, the best book, the best thing is Yoga Ratnavali. Then Hatha Yoga Pradipika is talking of Nada Anusandhana very clearly, the 4th chapter.
Pani hai, pani.
The 4th chapter of Hatha Yoga is talking very clearly about Nada Yoga as the highest sadhana. In fact, Adi Shankaracharya has already mentioned this, that it is one of the highest sadhanas. Even Hatha Yoga Pradipika mentioned this. Gorak Samhita is talking of Nada Yoga in depth, in detail. But the practices are not mentioned over there so much. So I would suggest better to practice. And then the books will become far more clearer to you. Instead of just knowledge, if you have an experience, then it makes a very big difference.
Thank you. Thank you for all the knowledge you have provided us, sir, today. It has been a wonderful session for all of our participants who has learned so much about Nada Yoga from you. Thank you, Swamiji. Thank you. Namaskar.
Hari Om Tat Sat. Thank you for inviting me. Hari Om Tat Sat.
Hari Om.
Hari Om Master, thank you very much.
Thank you.
Lilith Engle, thank you very much for joining in. Hari Om.
Hari Om.
Hari Om Tat Sat.
Next in the session, sir, Swamiji, okay. Next in the session, we have Shaina. Shaina, you there?
Hello.
So, Shaina is breath worker, what you call these days. She is a very fast growing meditator in UK right now. I will not waste again much of her time. Kindly please introduce yourself, what you're doing these days, and please carry with your sessions. And Shaina, end of the day, when we are distributing the certificate, I'll put your details with the email so people can contact you.
Perfect. Thank you so much.
There's an announcement before you take over. The last session was supposed to be done by Deepak Yogi. Unfortunately, because of technical issues, he is not available today. So this will be the last session of the day, and you are becoming, the last speaker of this session on this day today. Shaina, all the best. Thank you.
Perfect. Thank you so much. Just to double check, you can hear me okay here? Perfect.
Okay.
Thank you so much. Well, hello everyone, and I'm so excited to be able to share this amazing breathing exercise and deep meditation practice with you. So I am a teacher in the UK, and I do teach here predominantly. And over the last 6 months or so, we've really been growing of the breathwork practice because there's a huge highlight in the science with regards to healing the body on a deep and cellular level, and also just being able to tap into the parasympathetic nervous system, which is also going to enhance our level of well-being and our general cognitive function and things like this. So yes, after my 12 years of meditating and doing yogic practices, I am actually a yoga and meditation teacher as well, but I find that this breathing exercise is a way to really get us to that deep state of relaxation, kind of eliminating the sitting still process, because over here in the UK, we're very fast moving all of the time, so we're sort of learning to integrate these practices into our daily life. And even if we think we don't have time to fit these things in, we just know that we can always come back to the breath to enhance our health, our well-being, and also to expand our consciousness and our human energetic field as well. So when we do these breathing exercises, which I'm going to explain to you in a moment, we're heavily working with all 5 energy bodies. We're actually heavily activating the chakra system that runs from the base of the spine all the way up to the crown of the head. There's actually 72,000 energy points in the human body, but these 7 main ones are the ones that have direct correlation to our consciousness and our ability to raise our frequency, our vibration, to sort of be able to communicate with the universe. And this is why great yogis and great leaders in the world will say that they have almost downloads of information, because during these exercises, we're elevating our human consciousness. We're elevating our vibration as well, which is bringing us up into this high vibrational state. And it's almost like thinking that your brain's a radio receptor. So when we start to do these exercises, when we start to raise our human energy, it's like we start to fine tune into the messages of the universe, because everything essentially is universal. And as we know, everything's sort of interconnected. So when we go deep into these practices, we really start to feel a deep connection and essence with who we are on a personal level and who we are as a human family as well. And part of that, we also connect with nature. So we start to combine with the rhythm of the earth with humanity. And it's when we all start to get into this sync state rather than being chaotic and out of the flow of nature. Because I'm not sure where all of you guys are right now. I can imagine some of you are all over the globe, but in UK, as I say, it's very fast. So we're learning to bring ourselves back into harmony, back into this flow state. So I'm going to speak to you a little bit what we're going to be doing in our breathing exercise today. I have prepared a very special soundtrack which incorporates many different frequencies and binaural beats, which is going to activate the full brain in different rhythms. So when you hear the music, when we go into our guidance, you're just going to follow the music, all the instructions you hear. You don't have to think about anything. You're just going to make sure that you're laying down fully connected with the earth and also just tuned into this rhythm of the breath. So for the first round, we're going to breathe in for 2 and out for 2. So this is going to start to create coherence in the body. It's almost simply thought of putting everything into this smooth rhythmic line. So we're going to allow our heartbeat, our thoughts, all of our physiology to come into balance and harmony. And when we start to do this, we start to elevate our mind to that higher source of consciousness. So during this 2-2 rounds, you're going to feel this sense of energy. We're going to be doing a very energetic breathing exercise today. We're going to bring prana, life force, into the body with every in-breath. And with the exhales, it's this feeling of surrender, of completely letting go. And between each round of breath work, we're going to empty the lungs fully. When you hear the guidance to let go of your breath, we're going to sink down into this feeling of complete bliss. If it's the first time that you're doing this, just know that the mind isn't trained to go into these breath hold phases. So the fight and flight response in the mind is likely going to kick in the first 10 seconds and say, quickly, we need to take an in-breath. But just know this is the fight and flight response, keeping you alert, keeping you protected. So as soon as you hear this little voice, I want you to really sink into this feeling of deep trust and surrender, knowing that you can push past that voice just a little bit. And by actually doing this, we're increasing our resilience on a day-to-day level, because we know we're able to overcome stressful situations when we set our mind to these processes. It's also going to help us to keep in a rest and digest response in the brain. So by doing these exercises, we're keeping the body fully operational, because we don't realize when we keep the system in fight and flight, it's like our immune system, our whole central nervous system is being compromised without us even realizing. And this can be changed as simply as breathing in and out through the nose. A lot of people, especially in the West, find we breathe a lot through the mouth. And this creates many damages in the body. It keeps the brain very irritable as well. And it actually starts to lower our cognitive function. So whilst these meditative and breathwork practices are so good on a spiritual and profound vibrational level, but they're also good on a physiological level, because we're starting to heal. We're actually starting to make use of the oxygen that circulates the bloodstream. And by raising the levels of CO2, we start to send it back into the tissues and the cells that actually need it. So like I say, when we come into this breath hold phase, whenever you hear that fight and flight response kick in, I want you to just know and trust that this is when pure magic starts to happen in the body. Because if we start to hold the lungs empty for longer than 2 minutes, we actually start to circulate stem cells. And scientists and doctors are using stem cells to regenerate things like organs, tissues, and things like this. So we really need to remember that we have the ability to heal ourselves. It's within our innate capacity. And the breath, well, it's the greatest key because it's the one thing that keeps this vehicle driving. So when we learn to work in harmony with this vibration, this push and pull effect of O2, CO2, we keep vitality, we keep prana circulating in every vessel of our being. We keep the body young, we keep the mind healthy and strong. And we're also stimulating the vagus nerve. So this is the channel that runs up and down the spine, which sends cerebral spinal fluid back up into the brain. So by stimulating this nerve here, we're keeping the brain fully operational. And we're actually starting to send blood into dormant parts of the mind. So again, expanding this consciousness. And just know that the world record for holding the lungs empty is actually 18 minutes, guys. And this is amazing because the brain is going to kick in as little as 1 minute. So just know this is a trick in the mind. You're going to push past it a little bit more. But whenever you need to, you take a deep full in-breath and you hold it, squeezing the muscle at the base of the spine, your mula bandha, feeling the surge of energy rise all the way up into the center of the midbrain when you do hold your in-breath. And once you've returned to your normal rhythm of breath, after 10 to 15 seconds, you'll be guided into the next round. So we're going to do 3 rounds of this today, guys. Just to recap, in for 2, out for 2, for 3 rounds. Between each round, we empty the lungs fully. We surrender, we trust. We know that we're healing every part of the body on a deep, profound level. Whenever you need to, you take a deep in-breath, rebalance those O2 levels, and return to your normal breath. It's all guided. It's all going to be with deep and very sort of psychedelic music. So just allow yourself to tune into this flow. And just know that during this exercise, you will get tingles in the fingers. Sometimes it's likely to get cramps like this, and you may even get pins and needles. Just know that this is all part of the healing process, and it's absolutely nothing to worry about. But if at any point you do not like it, if you start to feel it's too much, just return to your normal breath. We really want to come back to this flow state. It's what we're training ourselves to do. We want to let go of this feeling of forcing, of controlling, but we do want to push just beyond our comfort zones because this is going to help us expand our mind. And we know that we are told that we only use 20% of our brain, but that is by no means to say that we are limited to only 20% of the brain, okay? It is within our responsibility to keep expanding these parts of the mind. And when we start to meditate, when we start to connect with nature, with these rhythmic things, this is when we really start to tune in with who we are, with what nature is. And we start to silence all of the external chaos, because Buddha, I think he says, sit under the tree and everything you need will come to you. And people take this so literally and think, well, I'm not going to get a wage this way. I'm not going to get a car this way. I'm not going to get a job if I sit still. But actually what he means is when we clear the mind, everything we need to take us to those steps will come to us in mind, in vision. And it's allowing us to charge up this trust, this feeling of knowing that whatever's to come is meant to be for us. So that's my explanation on what we're going to go into the breath work today. It is called Soma breath work, and I have specially made this music track for you to take you on a deep journey into the subconscious. So just know throughout this practice, just surrender, just let go, and let go of any expectations you may have, because we may even get psychedelic visions here. You may even astral project, which is also one of the things that can happen with these exercises. So go nice and deep, allow yourself to surrender to the breath. It's like we bring in this life force, this prana. We feel joy as we bring it in. And this exhale, you feel yourself from the crown of the head, just let go. It's like our spirit connects back with the earth, and we draw our awareness back in with the in-breath. Prana, life force, in with every deep and full in-breath. So we're just going to start now with a nice breathing exercise, just to correct your breathing, because it's really important. The way in which we breathe massively affects our health, our well-being, and it also is going to affect your journey into our breathing exercise today. So everybody just sit with a nice, comfortable back. You want to try to make sure that your tailbone is elevated a little bit higher than the knees so that we're not slouching down. You want to feel yourself lengthen from the base all the way up to the shoulders. As your breath comes up, just roll the shoulders up, back and down, and placing one hand on the heart chakra and one hand on the belly, on the solar plexus. And just closing your eyes, start to draw your awareness into your breath. Breathing in through the nose and out through the mouth, fully and deeply. And just really connecting with this feeling of bringing life force, this prana, this energy into the body with every deep in-breath. And exhaling through the mouth. Just start to surrender to this flow, to this deep feeling of rhythmic breathing, of circular breath. And we're just going to adjust the breath just a little bit. We want to start to ensure we're using the full diaphragm. The diaphragm is the pump that circulates energy and prana to every part of the body. So you want to connect with its full usage. As you breathe in through the nose, follow the breath into the stomach. Feel the entire belly fill up, all the way up to the heart, the shoulders, and the exhale through the mouth. Just let go of any tension in the body, any thoughts, any visions. Just send them away as you exhale. And draw your awareness back in with the in-breath. Using the entire breath to energize and circulate. And your exhale through the mouth, coming more and more into this flow. Fully in. And letting go. Keep using the full diaphragm to breathe. And with your eyes closed, just keep connecting deeply with this feeling, with the sound of the music, just coming more into the breath as you breathe in energy, life force. And your exhales through the mouth, just letting go of tension from the crown of the head all the way down. And 5 more deep breaths. And just really connect with this feeling of deep joy as you bring this fresh new life into your body. Smile as you inhale. And as you exhale, sigh of relief, let go, surrender. Breathing deep and full, connecting with this circular motion. Drawing more life force into the body and relaxing more and more as you let go. And anytime you find your mind wanders off, just bring it back with this feeling of in-breath, this flow, this prana into the body, and letting go. And whenever you're ready, we're going to lay down onto the ground because it's very likely that we will get lightheaded or tingly during this exercise. So please make sure you're supported. You're not doing anything that requires your attention. If you can take headphones, which will help the binaural beats go deeper into the mind for full brain activation. Otherwise, a good speaker with a dark room would be ideal. And just know that we're working with the deepest parts of the subconscious during this exercise. We are likely to get psychedelic visions at times because we're actually starting to release a chemical in the brain called dimethyltryptamine in very small quantities. So whenever you start to experience these sensations, these visions, you know the same in meditation, we send it away without attaching, coming back into the life force with every in-breath, witnessing, observing, and exhaling, just sending these visions away, coming back into these sensations. We want to keep the in and the out breath continuous with no pauses, like ocean waves crashing against the shore. We connect with the rhythm of nature, with the rhythm of our breath, and we just surrender to anything that comes up. Just allow yourself complete permission to let go, to completely sink down for the next 30 minutes of your time. So whenever you're ready, laying yourself and closing your eyes, drawing your awareness more into the body. And you can almost start to imagine that we have an eye at the center of our brain. And we want to see any visions that come up through this one eye. And if you want, we can on the last rounds. When you hear me we're going to chant together. And getting ready to completely surrender to your breath. Just trusting and knowing that we're healing the body and activating the deepest parts of the brain. And the more you breathe, the more you're going to feel. Just following your normal breath for a moment. I'm just going to make sure that the music is fully connected for you guys, because the music is very important to take you on a deep journey right now. So Gaurav, if you're watching right now, if you could connect my music somehow, that would be amazing. And just keep staying with the flow of your own breath, in through the nose and out through the mouth, connecting deeper. Keep bringing this life force in, this life force out. And as you lay comfortably with your eyes closed, just keep using the full diaphragm. And getting ready to completely surrender to your breath. Drawing life force, energy, prana into every cell in the body as you breathe in, and then exhaling, letting go of any tension and sinking down more and more. Life come into every cell as you breathe in, and letting go with every exhale. Fully into the belly and completely empty the lungs. When you feel the lungs are empty, just hold, surrender, and let go. Tuning in to the vibrations Just take a deep in-breath now and hold it for 10 to 15 seconds. Just return to your normal breath as we get ready to come into our second round. That's it, keep going, feeling this surge of energy come into the body with every in-breath. And then just surrender, let go. Each exhale. Into the belly and exhale through the mouth. That's it, we're nearly there. Keep going. Start to breathe a little bit deeper, feeling these sensations draw more and more into the body. These tingles, pins and needles around the body. Just trust the process. Taking a deep, full in-breath, and on the exhalation, just completely empty the lungs. Just have complete trust as you sink down a little bit deeper. Sinking past your mind's limits. in breath and exhale. Just as you sink down a little bit deeper, sinking past your mind's limits. Just trust, surrender. Completely let go to your visions, your feelings. You are amazing. Feel every cell in your body ignite. Seeing yourself glow with this bright, purifying light. And if you haven't already, take a deep in-breath now and hold it for 10 to 15 seconds. Inhale fully. And just completely surrender. Let go to this feeling of complete full body bliss as we start to heal on a cellular level. Whenever you feel that first urge to breathe, just sink past. Relax a little bit deeper and trust the process. Feel yourself on a vibrational level. Tuning in to the frequencies, the feelings, the sensations. If you haven't already, take a deep in-breath now and hold it for 10 to 15 seconds. And whenever you're ready, just return to your normal flow of breath until you hear the guidance for our final round. hold phase. Just allow yourself to go a little bit deeper into the subconscious mind, into the healing process of every cell in your body. Surrender, let go. And as you lay here in this moment of complete bliss, just witness any thoughts, any feelings. Don't think, just feel as you sink into the deepest parts of your subconscious. And if you haven't already, take a deep in-breath now and hold it for 10 to 15 seconds. Whenever you're ready, just allow yourself to return to your normal rhythm of breath, coming into the final relaxation, keeping the eyes closed, the attention drawn into the body. Just allow yourself to witness any thoughts or any visions that pop up. And without attaching, just allow them to pass. Just stay focused on the flow of your natural breath for the next 2 minutes. As you allow your awareness to slowly come back into your body. As you lay here with your attention drawn into the body, just start to witness any thoughts, any sensations. Become the observer. just slowly start to bring your awareness back into your physical body, taking a deep in-breath through the nose, interlocking the hands and stretching tall above the head for a nice full body stretch. And as you release the hands, just hug your knees into your chest as you gently rock from side to side, and give yourself a moment of gratitude, of self-love. And whenever you're ready, just press yourself back up into a comfortable seated position as we finish today's session with 3 conscious breath reminders. I hope you're all feeling amazing, guys. Before we break our attention out of this deep, harmonious state, we're just going to retrain the subconscious mind to breathe fully and deeply on a day-to-day basis. So we're going to finish again by taking one hand to the heart, connecting with this feeling of self-love, of gratitude, of awareness, and then bringing the other heart to the solar plexus, our place of inner fire, of confidence, of willpower. And we're going to use our in-breath in through the nose to charge up both of these energy points fully and deeply. And we're going to exhale through the mouth, just allowing ourselves to fully come back into this moment. So on the count of 3, fully and deeply, 3 times together. 1, 2, 3, fully in through the nose. And exhale down through the mouth. Next one, fully in, full diaphragm, circulating energy. And exhale back down. And our last one, fully and deeply, drawing all of this prana into the body. 1, 2, 3, fully in. Hold the in-breath for just a moment. Feel this life force. And with your exhale, just surrender. Allow your head to bow. Bring the palms to heart center. And just bowing to the divine within. Spirit, mind, body as one. And finishing our session. Thank you very much, everyone. I'd be very interested to know what sensations you got. It's very normal to experience colors because we're working directly with the human energy points here. So it's likely to get very strong visuals or strong connections to certain chakras. So if anyone has any questions, go ahead, drop them in the comments, guys. I will answer them the best I can for you. And I hope the audio came through okay. I know internet can be a little bit on and off sometimes. We're just going to remind ourselves always to breathe into this feeling of drawing life force and power into your body whenever you need to charge your inner light. And then exhales to release, to surrender, to start to become in rhythm with everything around us. Just anything that doesn't serve you, you can send it away with your exhale and you draw life back in with the in-breath. So we always want to work with this deep push and pull effect using the full diaphragm, energizing and circulating. Sending so much love to every single one of you, wherever you are, guys.
Rebel?
Yeah.
Yes.
Hello.
Hi. So there are question. What is the exercise name? Is it Prastika Pranayama by Deepak Sawant?
So it actually has its own, it's just Soma breath work. It's many different pranayamas incorporated in this because we're using belly breathing, we're using analom vilom sometimes as well, and we're also using the bandhas to push and pull energy. So I'd say it's a combination of many different breathing exercises, all traditional pranayama.
Okay. How many times a week do we have to practice this breath work?
I do it every single day because it keeps the body healthy and energized, and it also keeps vitality and energy as well. So, I mean, if you don't have time to do it every day, at least practice conscious breathing in and out through the belly, at least 5 minutes a day. But if you can, breath work every single day, guys. If not, at least 2 or 3 times a week would be perfect.
Is it safe to have breath work for pregnant ladies or someone people suffering from any other diseases like heart issues and all?
If anyone's experiencing any type of health issues, any serious ones, of course, you should always seek advice from a doctor or someone first if you're unsure about these things. But for people that have certain health conditions, it's good that we don't practice the lung holds just to begin with. And especially for pregnant ladies, we don't want to hold the lungs empty. We just want to practice this full diaphragmatic breathing. And the body will always tell you. It's really important that we listen. So your mind will tell you when you've gone to your maximum. And whenever it feels really uncomfortable, whenever you feel your body's resisting it, you have to listen and honor and you come back. So it's a gradual thing, but be very careful with the breath holds if you are experiencing any sort of health problems, guys. Does anybody have any other questions? Did anyone actually experience any tingling sensations or pins and needles in the fingers at all? Thank you very much, Manoj. Nice session. I'm glad. A lot of purple and yellow colors. That's amazing. So just know that during these exercises, we're subliming energy quite ferociously. We're really working with this Kundalini life force. So when we start to hold the in breath and the out breath, we're moving this energy straight back up into the higher energetic realms. And the third eye chakra, Ajna chakra, is correlated to the color purple. And sometimes when we start to see these purple lights, that's because we're directly sending energy up into the midbrain. So during these exercises directly that we're actually working with our human energy. So I'm really glad you saw that color. That's amazing.
Psychedelic effect remains all the time.
Say again, sorry?
Is psychedelic effects remain all the time during breath
No,
work?
it's different every single time. There's many different journeys. For me, sometimes I have very psychedelic experiences where I'll literally astral project to different areas and things like this. I think it's great for downloading knowledge or information, but sometimes I don't experience that at all. So I guess, again, it's letting go of this feeling of expectation and we just surrender to whatever sort of comes up, because the breath tells us what we need to know on that particular day. And you yourself, you know that as well. So yeah, I'd say just every day, take it as it comes, because there's going to be a different journey every single time. And regardless of the journey you have, we've done so much to work with the physiology of the body because we've sent the oxygen back to the places that need it. And we've already expanded our consciousness. So yeah, the more we do it, the more likely it is to experience these psychedelic feelings. And we do release DMT. And for a 2 or 3 hour journey, which we do sometimes, we do this in person because we need to be supervising the people, but they get very out of body, and very psychedelic, lasts for 2 to 3 hours sometimes. Amazing stuff.
Thank you, Sharon. You have been the showstopper for today's session. And I would like to inform you that you are the youngest among all the people who are giving sessions there. Thank you being a part of BreathLYFE and providing your input. And I really like the way you have taken whole session, calm, quiet, brilliant session together. since we don't have any questions, and unfortunately our next speaker Deepak is not able to make it, we've tried to connect it. So thank you everyone. Thank you.
Thank you so much for having me, guys, and sending so much love to everyone. Stay positive in these times.
Right. Tomorrow we have sessions on yogapreneur. Those people who are doing yoga business or any kind of business related to yoga, teachers training, you guys should be attending all the sessions tomorrow. Uh, we have sessions on how to take your business online and how to develop the business after the COVID era. Matter of fact, we are going to have a session on digital marketing too. So if you guys are into yoga training or any kind of personal training, please do attend the sessions tomorrow. We are signing off for today. Have a nice night. Good night. Thank you.